Have you ever time traveled? Of course not. So let me introduce you to this story about the character lying on the ground over there. He looks like he's on the brink of death, could go any moment. Someone shouted, the king's illness needs acupuncture and a small incision on the skull. Only then can the headache be cured. Another yelled, do not be ridiculous. The old man rolled his eyes and said, someone close to General Guan Yu. Clearly, you were just trying to use this opportunity to avenge him by killing me, and Chow Chow, the Wei King. He ordered, seize this man and throw him into the dungeon immediately. He shouted, this can't be your highness. If I am imprisoned, there will be no physician left to treat his majesty, or the crown prince's illness either. Are you saying that the lives of my son and I are in your filthy hands? How arrogant. Just a mere physician, how dare you? Soldiers, give him the harshest punishment so he can never speak again. A fly buzzes towards the main character. The main character painfully says, this is so unfair. I just want to save more lives. However, I have entrusted my medical books to the warden. Through those books, countless physicians will continue to treat patients across the country. Today, the sky is strange. The moonlight is brighter than ever. The main character thought, that is enough. He lies on the ground, eyes closed. Before passing out, he still had a lingering thought, as long as others could save people. Scene shifts to a foreign guy with incredibly beautiful brown hair. He painfully says, ugh, my head, where am I? Looking around, it seems like I am locked up again. He sadly thinks, how long will I be in prison this time? I am still alive. I have to save more patients. He bumps into something, a medical textbook. Why is a medical textbook here? It reminds me of my school days, that excitement when I read a medical textbook for the first time. I never wanted to put them down. If I had never come across them, perhaps I would never have become a doctor. He was even more surprised. This book is so accurate. It is on a completely different level compared to any medical textbook I have ever seen. Although these characters are very new and strange, I can understand every single word. Basic human anatomy. He was so shocked that he dropped the book with a thud. Suddenly, his head started spinning. The original owner's memories keep surfacing non-stop. Were these memories? They feel so vivid as if I lived through them myself. What is happening here? Could it be? Have I entered this man's body? Is there anyone out there? Someone explain to me what is going on. Now that I think about it, this is clearly a refrigerator, a device to keep food from spoiling. How is this possible? What era is this? This must be the memory of the young man I have entered. Vague information interview, class of 2024. How far into the future have I come? The computer screen suddenly lights up. This device is called a computer. The body is moving on its own as if it remembers how to use it. Impossible in this era. Physicians can even use this computer to look up surgical data from other people's operations. What a wonderful world. In such an era, anyone can become a physician. They can even reconnect severed nerves, not just blood vessels. Modern medicine is truly amazing. But why? Why was I sent to this era? There must be a reason. An annoying voice echoed. Haley Miho. Open the damn door, you skinny bastard. Stop messing around. His heart clenched reflexively. My heart reacted instinctively. This must be the person that young man feared so much. The voice continued to yell, do you realize the mess you have caused? Lee Miho, you, skinny freak. Are you crazy? Because of you we keep getting scolded. Do not you feel any guilt at all? The original owner's memories resurfaced again. Just once handle things properly, can't you? I am begging you, please. Kim Hyung-seon. Must be an intern doctor along with Lee Miho. Meeting someone from this era so suddenly like this is awkward. You're just an intern doctor, yet you dare to ignore the call. What the hell is wrong with you? Thanks to you, even I got scolded by Choi Young-soo. He angrily said, let me ask, what is with this bastard's attitude? Not letting go. What are you doing? Another brute? I see. I can't let myself be overpowered here. In that case, the main guy flips his friend over like a wrestler. Morning in a strange place. A yellow taxi drives Bonbon down the road. He painfully said, where did you learn a fight like that? I apologize. I have been through a lot lately. My body just reacted instinctively. From now on, I will be more careful. Please forgive me. Forget about it. What is with your way of speaking? Is my way of speaking in this era really that strange? Do you think I deserve to suffer because of you? Even finishing a shift as an intern is no excuse to ignore a call. The resident doctors are already gritting their teeth because of you. When they evaluate the interns later, what do you think will happen to you? Are you even listening? His eyes widened in utter surprise. The scene before him was truly breathtaking. It is really beautiful. That is a car. That is a building. And that must be a huge bridge. Gwen Seo looked at his friend with disdain, thinking this guy has truly lost his mind. What modern world? In my time, being able to ride a horse to a critically ill patient was considered lucky. If only ID lived in a place like this, how many lives could I have saved? Finally, the two of them arrived at a massive building. When we go inside, bow your head and apologize. The main character was still lost in thought. These cars. So convenient. Since arriving here, The main character's eyes have been wide open quite often. Hey, what is wrong with you? Are you okay? The main character's heart tightened. When I stood in front of this hospital, I could not stay calm. No, he's screaming at me. Lee Mi-ho died last night. The Grim Reaper took him away at this hospital. This hospital killed me. Memories flashed, and he was gasping for air. The scene was utterly chaotic. Many people surrounded the patient, saying still in fib shock at 01:50 joules. Everyone looks tense. He just stood there bewildered. The main guy looked like a complete failure, utterly redundant. The man scolding him was Huang Inbong, head of department, Seoul University Hospital. Honestly, even interns should know not to bring a dead patient into the operating room. But sir, the situation was very urgent. The patient only received basic treatment in the emergency room before being transferred. Do you think an intern rushing and pushing a gurney would recognize a cardiac arrest in that chaos? Anyway, the family has already filed a lawsuit, alive when transferred, and now because of a naive intern who did not properly check the patient, I am drowning in this mess. This won't blow over easily. That intern, leave me home. Make him work continuously until the case is withdrawn. When a main character received the order, he was utterly shocked. He tiredly dragged his feet home, then he drowned himself in alcohol. Strangely, the moon was exceptionally round and bright tonight. He painfully collapsed onto the bed. His eyes were vacant, as if he had lost his soul. And died young like that, only 27 years old from overwork. Whether it was back then or now, those at the top only care about their reputation. The two of them walked inside together. He was startled and thought, oh my God, looking at the bustling scene before him. He was incredibly excited and thought, so many patients, all these patients. Do I have to handle them all by myself? A voice echoed, you failures. Do you know how long I have been calling you? The man said, and Lee Mi-ho, just you wait. The person who did not seem very friendly was Choi Young-gully, a second-year resident in the cardiothoracic surgery department. Wake up, you useless thing, because of his hot-tempered nature. Not just Mi-ho, but all the intern doctors try to avoid him. What is this? You won't even answer now. Just keep being stubborn like that for me. He silently picks up the medical tools. Car accident victim. Look at those vital signs. It is a complete mess. While I place the central line, you handle the intubation. He coldly says, if you fumble like last time, the patient will really die. About to get scolded again. I can do it. The procedures that Mi-ho learned, they're all deeply imprinted in my mind, as if they were my own. Intubation, a life-saving technique when the airway is blocked or chest injury impairs breathing. He performs as if it is real. First, insert the laryngoscope into the mouth. The glottis can be clearly seen. Push the tube through right after the glottis. He calmly follows the learned steps. He does it smoothly and says good with satisfaction. The tube has been fixed. The doctor scolded you, but you still have to speak. Keep going. I thought if he stuttered, I would tear him apart. He must be lucky. Then the three of them worked smoothly without any issues. Unbelievable. I did not expect to see inside the body. With something called an X-ray, it seems like many ribs are broken. Is this a flail chest? The shadow indicates a broken sternum as well. A voice from behind spoke up. Did you call me? You are Ogu-kun, a specialist in thoracic and cardiovascular surgery. The X-ray shows a flail chest in the front, caused by multiple rib fractures along with a broken sternum. I understand. Flail chest, when 4 or more ribs or costal cartilages are broken in multiple places detaching part of the chest wall. At this level, myocardial contusion and sepsis are also possible. Check the ECG and flow with ultrasound. As soon as the tests are done, we will need to open the chest. Kim, call the anesthesiology department and book an operating room. Yes, doctor. The guy next to him ran off quickly. Oghan said, it seems like you're assisting in this surgery. What is going on? Then he calmly said, I will bring Song Jio and Mi-ho. Doctor, Choi, handle everything here. But, doctor, Lee Mi-ho has been banned from surgery until the end of his internship. The Class C disciplinary action remains, 10 days on call. Even so, I can't just let him be invisible. Honestly, I would rather keep him close where I can monitor him. Oh gee, Han seriously reminded. Dr. Lee, this time keep your mind clear. Yes, Dr. Main thinks. Finally, the surgeries we have only seen on video. We will witness them in person. Then everyone put on sterile protective clothing and entered using advanced equipment to operate. The lung is torn, bubbling with each breath. Blood is accumulating in the pericardium, swaying with each beat. First, control the blood around the myocardium, then drain the pericardial fluid. Stop the bleeding before connecting the drainage tube. Understood. Just as we thought, the main guy is very resourceful, stitching up the throat. Viewers are amazed. His skills are exceptional. I thought I would never stand before a patient again until the possession. Do I have a chance to perform surgery, myself? Everyone works together. The atmosphere is incredibly professional. As an intern here, probably not. But if only I could stay longer, not under the harsh conditions of the past, but in this era where everything is already prepared. I want to save more patients. The surgery was successful. Please do not worry too much. The family moved says, "Thank you so much, doctor." The elderly woman was deeply grateful to Dr. Lee. Besides the formation of blood clots as a consequence of myocardial contusion, what other risks could the patient face? Blunt trauma to the heart caused by force can result in bruising, impact, or compression. Ventricular fibrillation, heart failure, or supraventricular tachycardia may occur. So in those cases, what medications can we use? For ventricular fibrillation, any rhythmic drugs like lidocaine would be used. And for heart failure or supraventricular tachycardia, it is best to use cardiotonic drugs. Doctor, we thought it was not bad. I heard the residents gave him quite a hard time under Chief Huang's orders, but it seems he managed to overcome it all. Most people would give up, unable to endure this situation, but in his eyes, everything only made him more determined. I think that is enough to prove how passionate he is about this job. Doctor, the surgery is over and everyone is taking a break. Have some coffee. Thank you. Doctor, O proactively brought up Lee Maiho. At first, I thought he would cause trouble, but what he showed today was not bad. Yes, seeing him today, I was quite surprised. Doctor, O said, do not cause him any more trouble. Treat him well. The lawsuit has been withdrawn, and it seems he has started to think things through. What I mean is we should discreetly take care of him. Yes, I understand. I am heading out. Yes, you have worked hard. It is true that Lee Maiho was unfairly forced to take all the blame, but will that person just let it go? And the powerful man in the department, whom no one dares to disobey. I have not had a proper meal all day. Eat quickly before the emergency call. Is this what instant noodles look like? The aroma is amazing, and the noodle strands look unusual. This scent is something I have never smelled back home. Let's see how good modern food tastes. Dig in. Someone approaches and says, "Eating now." He looks over at the main character. He replied, "Yes, I just got some free time." Immediately, he snatched Main's cup of noodles. Main was about to eat, but ended up biting the air. He grabbed 2 bowls of noodles and said, "I am starving to death here. Really, I am about to die. Give me these to eat. Go make another one." "Yes, I understand," he screamed internally. Never seen a more vicious villain than Chow Chow. The chubby doctor was surprised. Men angrily walked out and said, "This guy needs a good beating to wake up. What is that bastard up to now?" Finally caught a breather. "Why is there always an emergency case on Fridays? That is just how it is." Then Yongo said, "By the way, what should we do about that anchovy kid?" An unknown intern left his post without saying a word and did not even check my messages. Plus, I feel like everything's been weirdly unlucky lately. He left after his shift was over, did not he? Questioning him about that seems a bit much. Even Dr. Oh, Gukin told us to stop. DRCH said that. Right now, all the interns are avoiding our department. And if we keep scaring them like this, no one will apply to our department this year at all. Cooking time, 3 minutes. Actually, I think we were just making things harder for him. Then at least make them work hard and teach them properly. You are just making it tough on him, but you are not really teaching him much. What is wrong with you? Did that anchovy guy bribe you with food or something? Said a child. The grumpy, overweight doctor glared at the ugly man in front of him. Night fell at the hospital. The doctors continued tirelessly treating patients. The cardiothoracic surgery, in turn, followed the residents during rounds to learn basic clinical skills, such as drawing blood, dressing wounds, and charting. Main follows behind Song Jicho, a first-year cardiothoracic surgery resident. When Main is with this person, unlike when meeting Choi Yong-soo or Kim Hyun-sun, his heart no longer races with anxiety. So he probably is not that malicious. Lee Min-ho, you only have a few days left in our department, right? What is the next emergency department? That place, they probably feel sorry for you there. It might be better than here. Does he understand the injustice that the owner of this body has endured even just a little? Anyway, it is almost October. Have you decided on I am thinking about thoracic surgery or neurosurgery? This kid is saying he wants to apply to our department after enduring those hellish days of on-call shifts. If he is seriously considering joining this department, he walked away and said, "Follow me. First, I will test your skills." The most important thing to note during incision or drainage of an abscess is what? When administering local anesthesia, the medication must be injected into the abscess cavity, so the depth of the incision must be carefully controlled. Song Jung-oh exclaimed in surprise, "You are good." The scene transitions to another patient room. A doctor is carefully attending to a patient. He carefully administers the patient's injection. Dr. Song Jo-oh is still seriously supervising the entire process. In my time, when there was an abscess, people would often create a hole in the skin to drain the abscess and then apply a bandage. But times have changed, and now they remove the abscess like this, tearing the wound from multiple angles. Recovery will definitely be faster. The patient has been treated carefully. His finishing technique is cleaner than mine, is not it? Just a few days ago, he could not handle a patient with the same condition. Has his skill improved this much? It is done. This is suspicious. No matter how good his observation skills are, he should not be able to improve this quickly in such a short time. Dr. Joe Oho thought skeptically. Could it be that just a few days ago, he could not do anything with a patient in a similar condition. But now, how has he improved so much? The main character said, it is done. The doctor kept thinking this is really suspicious. No matter how good his observation skills are, his abilities should not improve this quickly in such a short time. Could it be? Was he just unmotivated before and could not show his true abilities with skills like this? He could be very useful. He looked at the main character with a sly smile. From now on, I will treat him well so that he will want to voluntarily join my department. Transition to another convenience store. A hesitant voice speaks up. You really ate all of this. Oh my salary. It is no problem. It is what they call a triangular rice ball. It really is triangular. Songjo, looks extremely judgmental. The main guy is munching happily. Even though it has not used many ingredients, it has a really harmonious flavor. He also eats some noodles. The perfect combination. It is amazing that in modern times, everyone has access to delicious, cheap food available anytime. This is truly the most wonderful moment. Just as I thought, he is a bit strange, is not he? Dr. Joe always surrounded by a dark cloud. After finishing his meal, the main guy has to go back to work. This is the first time I have given medical orders, but it does not feel unfamiliar. Almost like I have done this before. Exactly. If my practical experience combines with the residual knowledge in Dr. Lee Miho's body, it could create a synergistic effect. Why has the soul possession not worn off even though a day has passed? The person I have time traveled into still has not shown up. Could it be that this is not soul possession at all? He smiled. If that is the case, we could live here and continue practicing medicine. Then the main character moved to another office. A voice echoed, yo. He witnessed another doctor stitching up a wound. Inside the room, a trainee doctor was diligently practicing suturing. The doctors looked down on the interns with disdain. One of them was struggling to stitch up the wound. This situation is like soldiers in the barracks. Have you given the order to the nurse yet? The main character responds, yes sir. Hey, I heard Dr. Some say that you are making remarkable progress in surgery. The others look surprised. Even the female intern doctor can't believe it. The main character responds, yes sir. Doctor, Yongo says, do not think too long. Just come to our department. If so, I will talk to other departments and tell them to take care of you during the transfer, period. This in the main character's mind, he contemptuously thinks who takes care of whom. This is my chance. I have to provoke him. I will consider other specialties, but unless there's a special problem, I still consider cardiothoracic surgery as the top choice. Well, that is what I said, but then I will choose a different department. Really? Hey, did you hear what a colleague just said? What about you guys? Which department are you choosing? Everyone looked visibly annoyed. He waved his hand dismissively and said, forget it. Do whatever you want. Lee Miho, sit down here. I heard you've been doing really well in practice lately. I need to check your wound stitching skills. Turns out this is an artificial skin used for early practice in wound stitching. It feels just like real skin. Practicing suturing with this will improve a doctor's skills much faster than practicing on fabric sheets. The main guy carefully picked up the needle and started suturing. All the interns watching were astonished. He said, am done. Done already. Dr. Yongo was extremely surprised. He rudely grabbed the suturing sample from him. Did you really do this? Yes, sir. He stitched a wound as long as a handspan in under 5 minutes. Moreover, the spacing between the stitches and the depth were completely even. Amazing. I think he is even better than me. Hey, Anchovy. Have you been secretly practicing behind our backs? Well, you could say I've been practicing stitching for a very long time. He pulled it out from Dorman's magic pocket again. This time, we will learn about the vascular anastomosis practice kit. You try this one. Artificial blood vessels. He is just an intern. The main character, not scared but excited, said, I will try. The old man still looking down on him said, good then. Try stitching the aorta first. Main guy starts using the needle to sew it up. As expected, the aorta is the largest and thickest blood vessel. He works quickly, yet carefully. Everyone watching is practically wide-eyed in disbelief. How is it possible? How can a medical intern be so skilled at vascular suturing? He is not even using a magnifying glass. Main guy does not seem to be struggling at all. Dr. Song-O observes with great satisfaction. Just as expected, this kid, Lee Mi-ho, the main guy said. So what do you think? People may not show it, but deep down they are all amazed. He is exactly the talent our department needs. The hospital lights remain on at night. A group of frustrated people walk out saying, that little anchovy made us look like fools. He is planning to switch to the cardiothoracic surgery department right in front of us to save himself. And what was that suturing skill? He used to be the worst one. Did he get possessed this time? And the way he speaks, it is like he has become a completely different person. Thinking back, this morning when I went to pick up that little anchovy, that scene appeared again. He looked up and was extremely surprised. That guy was watching a video about heart transplant surgery. This guy is really crazy. He is still studying even after going home, is not being on duty tired enough. He is trying his best just to survive. If it were me, I would have quit this job long ago. The group of people painfully said, thinking he was just a simple fool, but unexpectedly he stabbed others in the back like this. From afar, someone said, "Is not a great. I have never seen Miho like this, but it seems his passion for this job is incredible." Anjisu, Lee Miho's colleague. His wound stitching skills are not something you can easily acquire after just a day or two of practice. With hands like that, I think his choice to specialize in surgery makes sense. It naturally motivates me to push myself harder. I need to work harder and take another step forward. Meanwhile, the main guy is somewhere else, mukbanging a pile of food, saying my scalp itches so much. Time flies like a dog running in the field. In the blink of an eye, it is already 7:50. Inside the emergency room, the doctors are deeply focused. The patient has Morgani hernia. Morgani hernia is a condition where abdominal organs pass through a small congenital defect in the diaphragm located beneath the sternum. Under the guidance of Dr. Oguchin, the fixation of the defective diaphragm to the rib cage has been completed. Now all that is left is to close the wound. Dr. Lee Miho. Yes, I heard from Dr. Song that your suturing skills are on par with a final year resident, and it seems like you are about to become part of our family. Let me see how you will close this patient's wound. Finally my chances come. What is wrong? Not confident? No, I will do my best. Before closing a patient's wound, you must do a final check. This is a very basic step. Main was trusted and assigned the task to complete. The treatment is stable. Now, I will connect the drainage tube and start suturing the wound. Please hand me the drainage tube and the needle holder. Everyone quietly observes him. The surgery proceeds smoothly. The main doctor and the team cannot afford to be anything but serious about the patient's life until the sutures are completed and the wound is protected. He places the drainage tube with great care. Even with the muscle bundles where the wound edges have rolled inward, he meticulously finds each one and stitches them all back together. That Dr. Lee Miho. If we train him well, he is definitely going to be exceptional. No wonder Song Ji-oh praises this kid so much. The doctor said, "Cut it. Dr. Oh, I have finished closing the wound." All right. The stitches were handled carefully. The doctor glanced over and thought indeed. He called out loudly, "Dr. Lee Miho, you are the best intern I have ever met." Scene transition to room 16. Rest area. The doctor is checking the patient's condition. No matter what, Seoul University Hospital, cardiothoracic surgery, Professor Kim Ji-wook. This is not the stitching skill of a resident doctor. Moreover, it is not just this patient. All the patients operated on by Dr. Ogukin are like this. The frustrated doctor exclaimed, "Oh my god, the surgeon for that patient was Dr. Ogukin." Yes, that is correct. Or Dr. Ogukin's medical orders incorrect. No, orders are orders refers to the doctor's professional instructions for medical staff, nurses, technicians, etc., regarding the care and treatment of a patient. So why? Looking at the stitches, it seems that Dr. Ogukin closed the wound himself, but doing so would take away the practice opportunity for other interns. Upon hearing this, the first-year doctor glanced over and said, "Professor, it was not Dr. Ogukin who did the stitching." He was taken aback upon hearing this and asked again in doubt, "Was it you?" The doctor shook his head and replied, "It was Dr. Lee Miho." "Miho, are you talking about that intern doctor?" He said yes. When he recounted it, he was a rising star in our cardiothoracic surgery department. Meanwhile, the main guy was excitedly watching a surgery video. Early in the morning at Seoul University Hospital, a voice echoed, "I heard Lee Miho has been doing really well lately. He must have regained his form during his probation period. I heard he has practiced suturing so much that his skills are on par with a specialist. Dr. Song Ji-oh has been going around saying that we absolutely have to bring him into the cardiothoracic surgery department. After everything he has been through, does he still want to apply to our department? I heard he said he would apply to our department unless something special happens." "Really? Which department is he interning in?" "Inside the room belonging to the emergency center. Only the two of us transferred from the cardiothoracic surgery department to the emergency department." That girl looked at the main guy and spoke to him warmly. The two of them walked and chatted together without any sense of distance. The emergency department is a place where, instead of surgeries, people prioritize first aid and accurate diagnosis. "It is a pity I can't enter the operating room." He stood in front of the doctor's office door, then stepped inside excitedly thinking, "But I will have the chance to examine many different patients." The intern doctors were staring at me in confusion. The atmosphere was incredibly awkward. "Hee-wung, long time no see. Jisoo Sukshin, it has been a while. I am replacing you." "Yeah, How have you been? How's the cardiothoracic surgery department? I will be interning there next month. Miho, it has been a while too, has nodded. The polite guy extended his hand in greeting. These are Dr. Lee Miho's interns. It seems they just finished their internship in orthopedic surgery and were assigned to this department with me. I heard about the situation in the cardiovascular surgery department. I heard you had a really tough time. Yeah, a little bit. Let us do well together here. Maybe he's not such a bad person. By the way, who is the training sergeant in this department? I had a hard time because of Dr. Choi Young-soo. Dr. Woon-hai is a bit scary, but she's not a bad person. The one you need to pay more attention to than her is Professor Jang Tae-ju. When people hear his name, they freeze up. Someone repeats in surprise, Professor. Could it be the professor that the chairman recruited from K Hospital to establish the trauma center? It is him. He is the one who, whenever there is a trauma patient, pulls any resident nearby into the operating room. The ER doctors struggle because of that. Is not there any other professor who can stop him? Well, he has the chairman's backing. Who would dare say anything? He has not been here long, so everyone's just waiting to see what happens. Does he pull residents in with him? Yeah, but what does a resident even know? All they can do is prepare for the surgery. The main guy gets excited, thinking, should I step in and do it properly? Then our group moves to the cafeteria. About that internally, Miho. He is the one Professor Huang keeps making work non-stop after he was blacklisted because of a patient's death during transport. Right, the man said. That is right. It is Shin Hee-chul, the senior resident in the emergency department. Dr. Cha Sang-sik, a first-year resident in the emergency department, scratched his head and said, but of all the departments, he had to come 2 hours, making things quite awkward. What is so awkward about it? The issue is that the patient's family filed a baseless lawsuit from the very beginning. That complaint was truly infuriating. Oh, about that, no one should have been blamed in the first place. Professor Huang overreacted. I heard that after the lawsuit was withdrawn, he took sick leave, went on an overseas trip, and still has not returned. That is true. Hayes, such a petty person. But is it okay? Okay about what? I heard that Dr. Lee Miho was unreliable even before that incident. He is clumsy and awkward. He thought sadly for a while. Suddenly, an annoying voice rang out. Can't you do it right? It turned out, an intern was being scolded harshly. When will you ever grow up? Hey, Anchovy. Are you crazy if you can't even follow basic orders? What are we supposed to do? It seems this scene happens every day. Wake up, you idiot. Even scolding is tiring. He left angrily. The doctor quietly watched the main character in front of him. He was extremely sad. That guy is truly unreliable. Listen to Doctor. Oh, goodkin Dr. Lee Miho. I heard he has changed recently and is working more seriously, but tell him to be extremely careful. If he does well, it is fine. But if he is worse than when he was in the surgery department, I won't let slide. The doctor suddenly said angrily, tell him to be prepared because I am not the kind of person who lets things slide easily. I do not even know why I was transferred to this area. The head doctor said the emergency department is a real battlefield. Patients keep pouring into the clinics, and the beds are always full of patients waiting for test results. You should equip yourselves with basic clinical skills in advance. Everyone just listens and says yes. I heard Miho has decided to choose cardiothoracic surgery. Yes, with cardiothoracic surgery, you are certainly a promising intern, but that does not mean you can be lazy and just show up here for formalities. Does it? Just because you did not choose our department does not give you that excuse. He was tired of thinking. Listen to your own voice, you brat. Then he transformed into Miss Noyet, smiling sweetly. I can do that. The emergency department is a very important place for critical patients. I will study very hard. That answer is commendable. With such an attitude, have you familiarized yourself with the medical records received yesterday? He confidently replied, yes. His confidence left everyone wide-eyed in surprise. The medical records were open truly, a massive amount, but based on the knowledge and experience he gained from treating patients in the past. This information was not too difficult to understand. He was secretly suspicious, could not believe it. Could it be that this kid has straightened himself out? Then he turned and asked, have Dr. On Ji-soo and Byun Hee-woon read it? The two others awkwardly replied, yes, we have. He sneered and said, the interns are very enthusiastic today. Since it was the afternoon, the emergency room was quite empty. Let us review a bit, shall we? Everyone was scared out of their wits upon hearing that. Then he actually started testing the interns. He held a medical file and said, now I will ask. Patient Shim Jae-won, male, 72 years old, was brought in by ambulance last weekend. What details should we note in his medical record? The two of them looked down and thought, is over. The main guy spoke up. Patient Shim Jae-won was found unconscious by a passerby on the side of the road, who then called for emergency services. What was the patient's condition upon admission? Glasgow Coma Scale, *10, blood pressure /95, pulse 79, respiration 21, SPO 296%, pupils 3 mm bilaterally, normal light reflex asterisk in both eyes. Body temperature, 35.7 degrees Celsius. He calmly said. The patient had a strong smell of alcohol and was incontinent. He remembered every little detail precisely. Medical history and medication use are unknown. Look at this kid, he said, a surprise. Not bad. Now, let's let Dr. Beyond answer, he turned to the confused intern and asked, what tests have been done on patient Shim Jaiwan? The patient has high blood pressure and altered consciousness, so I think they did a head CT scan for the patient. After hearing that, he was dissatisfied and said, a head CT scan right away. Nothing was done before that. The interns immediately froze after being reprimanded. He turned to the female doctor and asked, Dr. Anjasu, try answering. She hesitated and said, before that. Then he grew increasingly frustrated and turned to the main doctor. Dr. Lee Miho, you answer. Because the patient has altered consciousness, we cannot obtain a history of medication use or medical conditions. He seriously examined and said that is correct. The test results show blood sugar levels are normal, so it is not hypoglycemia. An arterial blood gas indicates no issues with oxygen levels or ventilation. However, the patient's sodium level is very low. We can also consider hyponatremia, but since the symptoms did not progress too rapidly, we are less likely to think this is the primary cause of the altered consciousness. And because the patient was found collapsed by the roadside, the doctors decided to perform a head CT scan for the patient. What are the results? The patient was diagnosed with subarachnoid hemorrhage due to trauma and old cerebral infarction. Then you must report to neurosurgery immediately. Yes. After excluding the possibility of septicemia, based on the test results, the doctors have reported to neurosurgery. He excitedly looked at the main guy, this kid. I just asked an open-ended question, and he only needed to agree. No signs suggestive of septicemia. I just asked an open-ended question, and he only needed to agree. With his position, it is not just about recalling medical records, but he can also understand and apply the information. This guy is really interesting. He praised him. You're good. How can you remember all this? Yes. I just looked back and forth and suddenly a loud scream came from behind. AAA. The man frantically ran over and said, Doctor, please treat my son. Lay him down here. First, disinfect the wound. The boy was in unimaginable pain. His father anxiously comforted him. It is okay. Dad's here. The wound was on the boy's leg. That area was not just a regular scrape. It had a chunk of flesh missing. The intern doctors immediately joined in disinfecting it. Then they gathered around to check. It was bright red blood, which means the artery was damaged. Judging by the depth and direction of the wound, the descending genicular artery might be injured, maybe somewhere around this area. He pressed down really hard. Pressing down seemed a bit silly, but the main doctor was incredibly surprised and said, Dr. Lee, did you just find and put pressure on the descending genicular artery? How is that possible? I visualized the structures around the knee and imagined the path of the blood vessels. The nurse came over and asked, Doctor, local anesthetic here, right? Yes. He looked at the main guy in bewilderment. This kid. Is he a genius or something? He looks incredibly cool. A day passed and suddenly it was evening at Seoul University Hospital. Menu, kimchi, sweet potato stew, bean sprout soup, smoked duck meat. The main guy said with great satisfaction, Ah, this is so delicious. Although it is a bit late, it is still very tasty. I should come to the hospital cafeteria more often. So full I could burst. He kept thinking, what is on the menu today? Potato, stew, and mackerel. A voice called out, Dr. Anjisu. A man is scolding the female doctor and his cohort. When will you finally come to your senses? Are you an intern or a resident? The character, Jisoo, in this story just stands there looking down sadly. Seeing her attitude, he feels exhausted and thinks, what is it this time if Dr. An-ji-soo keeps making decisions on her own like this? She might as well be a resident already. The one scolding her relentlessly is Woo and Hai, a first-year resident in the emergency department. And if you're going to make decisions, at least make the right ones. I am sorry. The female patient was admitted for abdominal pain. I've not even taught that. With female patients, you should always consider an ectopic pregnancy. She said she is married, but she just had her period a few days ago. So it seems Jisoo made a mistake. It is unfortunate, but sometimes getting scolded is the best opportunity to learn and grow. But to get to the resident doctor's office, we have to pass through here. Who told you that if a patient is menstruating, they can't be pregnant because of your thoughtless actions? Now, I've been called up and scolded harshly. The atmosphere suddenly became tense. What is going on? Why are you walking like that? Oh, I thought you two were talking. Dr. Wu, have you had dinner yet? Today in the canteen, there's mackerel and stewed potatoes or something. It is really delicious. When I was an intern, I did not have time to go to the canteen, so I only ate bread or instant noodles, and you dare to give me suggestions here. Interns these days live so relaxed. Since it is your first time, I will let it go. But if you make such a mistake again, I won't forgive you. Understood? Yes. In the first year, Doctor stormed off. A voice called out after her, Minho. It was just Sue shyly saying, thank you for helping me. Yeah, it is nothing, he casually thought. I did not even plan to help her. The scene transitions to another storyline. A lazy person yawns, loudly yawn. Is the guy with glasses next to the main character looking a bit tired as night falls? An intern in the emergency department working during the day and taking turns on night shifts. Staying awake for 24 hours straight is almost impossible. On the contrary, the main guy thinks it is tough, but for me, I really want to see my patients every day continuously. In my previous life, I stayed up many nights to care for play patients. The mysterious person ahead said, so, you Boxian, a third-year resident in the emergency department holding a medical record asked, were you the first to find the lady unconscious? When was that and what were the specific circumstances? She said she was under the bathroom for a bit, but then I heard a loud noise. When I went in, she was unconscious next to the toilet. How long do you think she was unconscious? The old man said, about 1 minute from when I found her. It seems she regained consciousness on the way here. Is she acting normally now? The husband said, she seems normal now, but considering her test results and that this is the first time she has fainted, I am a bit worried. I understand. I will do a quick examination. They need us a basic checkup. Everything seems normal for now. Does she have any medical conditions? She has hypertension and diabetes, and she is taking medication for both. Madam, do you remember how you felt right before you fainted? She painfully recalls, suddenly my head was spinning and I felt like someone was draining my blood. Do you feel nauseous now? I feel a bit uneasy, but I can manage. When you fainted, your limbs did not twist, right? I remember just fainting, so there were no convulsions. The main guy watches seriously because the patient was brought in after fainting. We need to do a head CT scan. But before that, we need to do an ECG and blood gas test and also examine the chest and abdomen. These are the tests that an intern would typically think of first. Fainting is a temporary loss of consciousness. It seems she just fainted briefly due to taking antihypertensive medication. A patient will recover quickly, he thought to himself. Is it really necessary to spend money on these tests? But as an intern, I could not say anything. Then the other doctor said, we will start with an ECG first. The old lady lay there obediently, and the doctor began the procedure. He quietly walked over to observe. Doctor, Layman Ho, what do you see? The left ventricle looks normal, and I do not see any signs of a descending aortic dissection. Not bad. Most interns do not even know what they're looking at. Luckily, there is no hemorrhaging. After we do a head CT scan, we'll know more for sure. But as for the chest and abdomen, I do not see any abnormalities. So in the end, they still went for the CT scan. Fortunately, the lady is not facing any serious issues. In my opinion, the blood pressure medication caused her blood pressure to drop temporarily, which affected the blood flow to her brain and made her faint. There is nothing serious at the moment, but if you are still worried, she can be admitted for a day or so. Of course, the cost will be higher, but being admitted will allow us to monitor her condition better. Immediately, they said, we would like to admit her. All these tests and now the admission. Turns out this is how hospitals make money. Any more questions? Do you know who the next chief resident will be? Rumor has it that it is Dr. You boxed in. The professors seem to have their eyes on him. Now I understand why. He is incredibly fluent. He said, I will guide you through the admission process now. Suddenly, there was a loud noise nearby. What kind of test are you planning to do? Are you crazy? You should have given me painkillers, not sent me for tests. The difficult patient shouted, where is the director? He yelled like he owned the place. Director, come out here. Another doctor came and said, dear patient, please do not behave like this. Who are you? First of all, please calm down. He did not hesitate, and punched immediately. He ran into a reckless fat guy. I have been in pain for hours. I have been waiting silently for hours. Is this how you treat me? Looking down at the doctor who was stunned from the hit, he rushed toward Jisoo again and said, do you think I am easy to deal with? The main guy stepped in to stop him. Who is this guy? He is originally from Haiphong, so he does not beat around the bush either. Some people stared at him in confusion. Even Jisoo did not expect it. The look on his face was incredibly tense. Then he calmly closed his eyes. Oh no. Damn it, I did not realize in time. My fist swung out again instinctively, like a defense mechanism, but I have seen plenty of guys like this during chaotic times. He groaned in pain. Ugh, you bastard. I will kill you. Then his bulky frame charged at him. Did these animals just try to solve everything with violence instead of talking? The main guy simply tripped him. The only way to deal with people like that is to respond in kind. A bunch of guards ran over and said, you can't do that here. Let go or not you gonna let go? Do you know who my father is? He turned to his colleague and asked, are you okay? Yes, I am fine. And you, are you okay? Yes. The main guy looked at them and smiled. What a relief. After that, time flew by and they were no longer at the hospital. A hand stretched out, followed by a satisfying stretch. The guy with glasses said, "Finally, we are off work. At least in the air, we can finish on time." When I was on duty in the cardiothoracic surgery department, I would get woken up in the on-call room at any time. Yeah, that apartment is really tough. The main guy walked alongside them, glancing around in surprise. "Hey guys, I want to try that place." He pointed at the restaurant in front of them. So the group went in drinking soju in the morning. It is quite refreshing and fun. It's been a long time since I drank alcohol. Soju, it looks completely clear like white wine. He takes a sip. The taste is not bad. Ah, this is better than I thought. Feels like I could drink it like juice. Then he takes a bite of meat. Okay, time to try this pork belly. Hate his pork belly, buddy. He widened his eyes in surprise. This is unbelievable. It is too delicious. Even better than any lavish feast I have ever had in the past. There is absolutely no pork smell, and the texture is incredibly tender. He eats excitedly. Maybe I should wrap it in lettuce like this too. I thought the night shift would be more relaxing, but it turns out there are too many difficult patients. Why are there so many drunk people coming to the hospital? Exactly. People who should just go to the clinic or come on their own keep calling ambulances. That means the patients who really need emergency care can't get an ambulance right away. It's so frustrating. But even so, thanks to Miho, I feel much better. He was eating ravenously when he turned around. You took down that gangster-like patient with just one move. Ugh, the guy with glasses groaned. The spot where he hit me still aches. Miho, you are really impressive. You're so skinny. Where do you get that strength from? Well, I do not know either. Let us just say my master did not teach me medicine. I am just glad the martial arts I learned back in the day have not completely faded from this body. Sit a little longer. You were so dedicated more. He reminisced and felt a wave of emotion. Then he spoke sternly. No matter what, even if he is a patient, I can't let him threaten the doctors and cause chaos in the hospital. The emergency room is full of critical cases. Who knows what harm he might have caused to other patients if I had let him be. Exactly. He even looked like he was ready to use medical tools as weapons. And not just today. I have also been really amazed at how you remember all the medical records. They just flow out of your mouth. That is because I have reviewed them a lot. The bespectacled kid thought, to be honest, I was a little jealous. It even motivates me. If I want to catch up to Miho, I will have to work harder. A staff member approached and said, "Here are your cold noodles and mixed cold noodles." The main guy was confused and asks, "What is this? What do you mean this is cold noodles?" "It is best when you place it on top of pork belly and eat it." He does just that and stuffs a big mouthful into his throat. He is certain of one thing. From now on, I will definitely come here after work. Afterward, the group eats their fill at the restaurant. The main guy wraps up the food tour and heads home. The world keeps spinning. He has not even drunk much, yet he is already so drunk. Exhausted, he thinks my stomach feels strange, and my limbs are numb. We should go back and get some sleep to clear our heads. Then he stretched out completely. His heart suddenly started pounding erratically. He clutched at it in pain. Then he collapsed. Finally, he lay still on spot. What is this sudden trembling feeling? Do not tell me. The soul fusion is starting to break. If my soul leaves now, this body will only be found as a corpse, he thought sadly. And if the possession breaks, where will my soul go? Back to the past, or into someone else's body? His mind screamed, "Not yet. I do not want to go back. But my eyes are heavy. They keep closing against my will." Then a beam of light shone, making him reluctantly open his eyes. Ah, he lies on the ground in pain. Ah, he wakes up bewildered. The possession is not over yet, strange. Based on yesterday's symptoms, it seems like it is about to wear off. Is it just because of the alcohol even with a weak body that drink is nothing compared to baekju, a traditional Korean rice wine? The name means 100-year wine, based on the belief that its ingredients promote longevity. He looks bewilderedly at the vomit beside him. That is right. This body is already weak, so that might explain it. It is good that the possession is not over yet. Has it been a week since I started living in this body? He continues to stand up, eyes bright with thoughts to this extent. I feel like I could stay here and continue treating patients. But before that, he secretly put the poster in the corner, then painfully said, "We should clean this place up first." Scene transition to the dean's office. The serious man is organizing his paperwork. He looks down slightly surprised. A knock on the door. "Come in." "You call for me, sir." Jang Taeju, professor of emergency medicine, is entering. "How long has Professor Jang been with our hospital?" 3 months. "Then you must be settled in by now." The director said, "You are aware that in March, the Ministry of Health and Welfare will review applications for Level 1 trauma centers. Right, our hospital, along with 5 other university hospitals, has made the shortlist." Young immediately responded, "I know." The director continued, "So is the preparation going well? I have been trying to persuade some outstanding residents to transfer to the trauma surgery department, but they're not very keen because they have already chosen their specialties. It won't be easy to sway them." The old man said painfully, "Without residents, the ministry won't approve us. We will have no choice but to offer better terms than before to bring them in. That will trigger strong reactions from other departments. But Dr. Hong said, it is unavoidable. To be honest, even the department heads know that trauma surgery is fundamentally a grueling path, so they won't oppose it too strongly. He squinted and said, I will have to think more about that. I need your decision soon so we can act more decisively. To open a center, we will need to coordinate closely. And the ministry's reviewers are all doctors themselves carefully examining surgical records, so we should start preparing them right now. I will try to meet with the chairman today. Dr. Kong said, thank you, sir. But may I ask why you were so invested in wanting a trauma center? As you know, it does not make money, and government funding only covers basic maintenance costs. He simply smiled at Dr. Kang's question. A high-end shopping mall does not just sell luxury goods, does it? If Seoul University Hospital prides itself on being the nation's leading hospital, it cannot lack a trauma center. Then Dr. Kang quietly left. So in the end, it was about face. Even so, if a trauma center allows us to save even one more critical patient, it is a good thing. A voice spoke up. Good afternoon, Professor. He looked up and said, Dr. Shin, I was just talking to the director. Any good news? I have been asking around my classmates. When the trauma center opens, there will be many positions from associate professor down to assistant. As a specialist, should not you start thinking about tenure? Dr. Shin asked in surprise. Tenure understandable because Dr. Shin was very happy. He said, of course, I will work even harder. Alright, make sure to check out the residents too. And if you find a promising intern, do not forget to recruit them. Right away, Shin said. Come and think of it. There is an intern in the department with very skilled hands. That intern is currently on duty in the emergency department. Dr. Khan was not convinced and asked again, really? Who is it? The scene cut straight to the main guy. Who else could it be? The treatment is going well, so recovery should be quick. Please do not worry. Thank you. Everything was calm, but suddenly he sensed something was off. He turned around and saw two doctors approaching. Seoul University Hospital, Professor Jang Tae-ju. He quietly observed and thought, that is Professor Jang Tae-ju. He stood up. Good afternoon, Professor. Dr. Kang said, I heard from Dr. Shin Hee-cheol that Dr. Lee Mi-ho has very skilled surgical hands. Hearing that, he sincerely replied back in the CS department, Professor Ogukin once trusted me to complete a surgery. He let it in turn close the incision. Yes, usually, closing an incision is assigned to residents. If this intern does not have some powerful backing, then his skills must be exceptionally outstanding. Then Dr. Kong said something shocking. Do not you want to hold the scalpel sooner? He was so happy that he said, yes, doctor. Finally. Is this my chance to enter the operating room? A painful voice echoed beside him. Oh Lord. A nurse helped the elderly woman and said, please lie down here. Doctor, leave me ho. Follow me. Let me see for myself if you really have the skills to be trusted with closing surgical wounds or not. Then Mr. Kong immediately approached the patient. The female patient was experiencing abdominal pain. She clutched her stomach and said, my stomach, it hurts so much. Dr. Lee Mi-ho, yes, Professor. Dr. Lee Mi-ho, examine this patient. Chin Cha, Main, and Shin, the little boy with a pencil, were left speechless. Dr. Zhang suddenly made a decision. Dr. Lee Min-ho will examine this patient. The main character and the doctor next to him were completely stunned. Professor, but Dr. Lee Min-ho is still just an intern. I am here and Dr. Shin Hee-cheol is also here. Is there a problem? Even though he is an intern, he has already undergone 10 months of training rotating through various departments. At the very least, he should know how to examine a patient with abdominal pain. He looked at the main character and said, go ahead, Dr. Lee Min-ho. Yes. Then the patient's chart for Lee seeing me was handed to him, still warm. Does it hurt on the left side of your abdomen? Yes. My stomach started hurting while I was working in the office, and it has been getting worse. What are the patient's vital signs? Blood pressure is 132/68, pulse 90, SPO 298, and temperature is 36.4 degrees Celsius. Gulp. The main guy gently said, I will touch your abdomen for a moment. No matter how painful it is, please bear with it for a bit. If she is in this much pain, the main guy is probing different spots on her abdomen with his bare hands. She's trying to endure the pain. It is not appendicitis. It is the lower abdomen, so it is not a gastrointestinal perforation. I do not feel the weak pulse characteristic of pregnancy, so she is not pregnant. It is also not a kidney stone in that case, so it must be ovarian torsion. Ovarian torsion. A condition where the ovary twists partially or completely causing ischemia. Then he moves it to a nearby area. At this point, the patient screams, oh, it hurts this pain response. It is clear. In my opinion, it seems like ovarian torsion. We will need a transvaginal ultrasound to be sure, so let us transfer her to gynecology. Doctor, Lee Min-ho, should not we do an abdominal ultrasound? This is a high-priority emergency patient. You need to establish in 4-line and do the marker test sooner than before and before transferring her to gynecology. The pain is near the fallopian tube, but it could be a ureteral stone or an ectopic pregnancy. This diagnosis comes from my past life experience, so of course, they won't believe it. I am sorry. I was a bit hasty. Dr. Shin-hee Chul, please finish examining the patient. Dr. Lee Min-ho, you may go. He leaves sadly. Yes, I understand. That is not an opinion a resident should give. Seeing the patient in pain, I acted too hastily. While they do this, the fallopian tube gets twisted, and the patient will endure extreme pain. They need surgery as soon as possible to alleviate the burden on her body. It is really unfortunate. Professors, Office Professor Jong Tae, you hastily judged him, right? No matter how well he does, he is still just an inexperienced resident. That is understandable. But even so, it seems I have become too impatient because of the new severe trauma surgery department. A voice echoes Professor Jang. It is Shin-hee Chul. He says, come in. How? Is patient Lee seeing me? The pregnancy test came back negative, and we could not identify any abnormalities on the abdominal ultrasound. So we transferred her to the OB-GYN department for a transvaginal ultrasound, and we just received a call from the OB-GYN department a moment ago. They discovered she has ovarian torsion, so they took her in for emergency surgery. He was absolutely shocked. He could not believe it. So Dr. Lee Min-ho's initial diagnosis was correct. Yes, just by palpation, without even needing an ultrasound, he knew the patient had ovarian torsion. No way. Even I would struggle with that diagnosis. I think it was just a coincidence. I agree. Still, for a newcomer, he did very well. Then he pondered, I want Dr. Lee Min-ho to examine another patient. What? He was just lucky. Asking him to examine again might be a bit much. That is because I can't accept that it was just a coincidence. To ensure Dr. Lee Min-ho did not misdiagnose, and if it truly is his skill, should not we let him know that coincidences do not happen twice in a row? Main characters stumbled upon a medical record that diagnosed ovarian torsion, so it turns out the fallopian tube was twisted. Intuition. Intuition is certainly important, but in this era where all medical facilities are perfectly equipped, minimizing risks is even more important, considering the possibility of medical errors from the patient's perspective. Dr. Kong pats Main on the shoulder from behind. Dr. Lee Min-ho, have you eaten yet? Oh, I am planning to eat after finishing this task. He smiles cheerfully and says, let's eat later. Main looks confused. Then they actually go to the dining room together. Madam, when did your headache start? My wife was preparing lunch before I got home. She said it was early, but she felt unwell and laid down on the sofa. Then suddenly, started vomiting. Yes, please continue. I checked her pupils with a flashlight. They are 3/3 and have normal light reflexes. Judging by her eyes, she is still conscious. Yes, I am awake. She suddenly spoke up. Sorry, are you an intern doctor? What? Oh yes, that is right. She weakly tried to speak. I want to be examined by a senior doctor. She looked at Main with disdain and said, because you are an intern. Can you make an accurate diagnosis? Then Dr. Kang interrupted. Dr. Lee Min-ho is a highly skilled doctor. You can rest assured receiving treatment from him. Even so, I still want to be examined by someone more experienced. Main guy thinks angrily. I understand, but in my previous life, people had to queue just to be examined by me. Being told off like this is quite embarrassing. Professors are the ones who review the doctor's diagnoses. They do not examine individual patients. So please allow me to conduct the basic checkup. Then the professor will give the final diagnosis based on the test results. Then she reluctantly replied, I understand. So when did your headache start? I was preparing lunch for my husband to come home when suddenly the headache hit. I also felt nauseous, so I lay down on the sofa. The pain subsided a little, but when I sat back up, my head started hurting again and I felt like throwing up. Then I vomited. Judging by her speech, she is still conscious. Hold on a moment. Pupils 3/3. Light reflex is also normal. A sudden severe headache. This symptom often occurs when there is bleeding between the brain and the skull, increasing intracranial pressure. Her frequent vomiting almost confirms this. Subarachnoid hemorrhage. This is a condition where an artery on the surface of the brain is damaged, causing blood to leak into the space between the brain and the skull. This increases intracranial pressure and can likely lead to severe brain damage. First, we need to do a brain CT scan. Oh, really? Honey, wake up. No, you can't do that. The patient needs complete rest. So we will take her to the imaging department while she remains lying down. What? So sudden, but we walk here ourselves. Please follow my instructions. We need to be as careful as possible until we get the patient's test results. The patient's husband hesitantly said, yes. The two doctors and the professor calmly monitored Mr. Main. Then they were escorted away by the hospital staff. This patient walked in on her own, so why insist on moving her on a stretcher? In my opinion, I suspect the patient has a subarachnoid hemorrhage so I think we need to control her intracranial pressure. At that moment, he thought, idiot. The fact that he skipped all other tests for a headache and went straight to a CT scan is already ridiculous. And now he is even predicting the diagnosis. He is definitely going to get scolded. Dr. Lee Min-ho. Usually, when you see a patient walk in on their own, you would not suspect a subarachnoid hemorrhage. Your intuition is good. When reading a CT scan of a patient suspected of having a subarachnoid hemorrhage, which area should you examine most carefully? It is the area most likely to bleed. Where is the most likely place for bleeding to occur? The first place to look is the pentagonal shape. You must thoroughly examine the pentagonal shape after carefully checking the interhemispheric fissure, which clearly reflects the bleeding status in the anterior communicating artery. The anterior communicating artery, the most common vascular location accounting for 25–38% of all cerebral aneurysms. We should also check the fluid in the lateral horns, the sylvian fissure, and the interpeduncular cistern, one of the pathways of cerebrospinal fluid. If it has the same density as the brain parenchyma, it is considered abnormal. Finally, significant enlargement of the inferior horn of the lateral ventricle can also be a sign of subarachnoid hemorrhage. You have studied very well. I will let you know when the results are in, so go back to your duties. Yes, Professor. Then the main character leaves. It seems like Dr. Lee Min-ho got lucky again. What do you mean by lucky? This is a patient whose symptoms alone could suggest hemorrhage. What? We should acknowledge his efforts. You could say he spoke hastily about the ovarian torsion case, but for the subarachnoid hemorrhage case, he gave his opinion after I asked, and he suspected subarachnoid hemorrhage in a patient who walked in on her own and moved her on a stretcher to reduce pressure. At this point, it is not a coincidence. You have to admit that he has done a lot of research. I think so too. He did all that even with me, a professor watching, and he confidently presented his opinion without hesitation. His attitude towards patients is also very calm. All right. If there's a patient who needs emergency surgery, I will have to bring Dr. Lee Min-ho into the operating room. That night in busy Korea, it looks like a rag. Do we eat something bad? My stomach hurts like crazy. Even when I press on the pressure points, it does not get any better. I ate hastily. That is also part of the reason. But after seeing that patient with a headache, I thought of Chow Chow, which put me in a bad mood. I looked it up in the documents. On January 20, a year after Guan Yu's death, Chow Chow died in Luoyang at the age of 66. There are some anecdotes about Chow Chow's death. When building the Jiangsu Hall, he cut down a sacred tree, and blood flowed out from it. Seeing this, Chow Chow fainted. When a pear tree was grafted, its roots were damaged and bled. This made him sad for a long time. The story goes that after seeing these things, he was bedded in and fell ill. He did not live long after I died. If only he had listened to me, not only he, but also his son would not have had to die. Even so, I can't say he deserved it. Then he tearfully thought, anyway, my stomach hurts like hell. He took out a needle and said, for now, I will only do this. Then he stabbed hard into his nail. Suddenly, someone called from behind, Dr. Lee Min-ho, what are you doing? I think I am having indigestion. He replied, then you should take some indigestion medicine. Are you performing and proven medical practices in a hospital? Oh no, I'm acting like my old self again. Oh, I am sorry. I will let it slide this time since it is your first time. If anyone asks, to say you prick yourself while practicing suturing. When doctors of this era have a negative view of past methods, I need to reevaluate the medical techniques I know and see how practically useful they are. If only I could investigate them more thoroughly. The phone rings. Yes, this is S. University Hospital Emergency Medicine Department. Her voice sounded very panicked. Yes. Then her eyebrows skinship continuously. Hey, a 10-car pileup. The scene is extremely chaotic. Shouting into the phone, what? Dr. Lee Min-ho. They said there was a 10-car pileup on the Saigon River Highway. Many emergency patients. The medical staff is asking how many patients we can take in. Main immediately says, I will go ask Professor Jiang. Professor, this is Lee Min-ho. There's been a 10-car pileup on the Riverside Highway. Yes, I understand. He hesitantly says, we can accommodate up to 20 people. After that, it was extremely noisy in front of the hospital gate. A traffic accident during rush hour. Unbelievable. Oh my God. Today is my wedding anniversary, so I have to get home early. At this rate, my marriage will fall apart. A person stepped out and asked, why did this suddenly happen? A line of doctors and nurses stood there. Our hospital does not even have a major trauma center. Doctors from other departments still get to go home, even if there is a traffic accident. Rumor has it that we will be approved to establish one next year. The person next to him whispered, honestly, it is just more work, and we will still be a loss. I do not know why he is so greedy. I am sorry you can't go home because of me. Professor Jiang, there is nothing to apologize for. It is not your fault. Because I chose trauma surgery, My wife constantly nags me as long as I can save patients. It was a little nagging. Then he looked at everyone meaningfully. You praised him. He was openly mocking but handled it calmly. This is definitely not an ordinary man. I've seen many great figures in the past who were like that. Then the two looked back. A fleet of ambulances rushed in. All the doctors in the hospital sprang into action. Everyone move quickly. This patient to bed 1. This patient to bed 2. Tell me the patient's condition first. Her name is Kim Hyunjin, female, 29 years old. Her car crashed into the guardrail. Oh my god. Where is this patient's leg? Doctor, Kim, contact anesthesiology immediately and tell them to prepare an operating room. Yes, Professor. His name is Shin Dong-chul, male, 31 years old. He was found with a steel plate from a truck impaled in his lower right abdomen. His blood pressure at the time of discovery was, this patient is in critical condition. Sir, I need to insert a tracheal tube, so please open your mouth. He is in too much pain to do anything. It is bad. It must hurt a lot. He can't even open his mouth. Dr. Shin Hee-chul is setting up AC line, so the anesthetic and muscle relaxant will be administered soon. But sir, you need to cooperate so we can treat you quickly. Let me try. Faster than the current method. There's a way to intubate him faster. Doctor reminds Maine. If you're thinking of prying his mouth open with your fingers, do not. You'll get your fingers bitten off. He says, I have another way. If you stimulate the acupressure points and nerves like this, then he performed the maneuver. The patient immediately opened his mouth. Everyone was amazed. How did you do that? I once watched a similar video. This won't last long, so please intubate him right now. Got it. Then everyone quickly inserted it into the patient's throat. Time passed. The doctor wearily walked out. It seems this patient also needs immediate surgery. Contact the anesthesiology department immediately and tell them to prepare the operating room. You 3, assist me. Professor, please consult with the general surgery department for this patient. Do not, you see the general surgery doctors are swamped right now. I will be the lead surgeon. You just need to assist and do it well. Then the team proceeds into the operating room. As the wound is opened, the spermatic cord is a structure resembling a string running from the abdomen to the testicles containing part of the vas deferens. The right side is severed. This is serious. Because the left spermatic cord is intact, he won't suffer from erectile dysfunction, but the patient will be devastated when he regains consciousness. Judging by the depth and severity of the wound, even a highly skilled surgeon at the professor level would need a long time to perform the reconnection. Professor Zhang, who focuses solely on saving lives, may or may not be able to reconnect all the severed structures of the spermatic cord. He operates very quickly but lacks precision. As for the other two, those who are still hesitant, even when entering the operating room, they're not worth mentioning. If I were a surgeon in the operating room, the doctor continued working and shouted, cut. He is cutting it to the exact length. The rumor that he gets to assist in many surgeries in the cardiothoracic department must be true. From testicular veins to the bladder artery and bladder, the surgical sites were complex but successfully completed. He could have suffered from sexual dysfunction, but he was blessed. Maine's eyes were tense. The surgery. Is it over? Professor, what surprise that it ended earlier than you expected. Professor, are not you planning to reconnect it? It would be best to reconnect, considering the patient's future sexual satisfaction. But the emergency room is filled with patients hanging between life and death waiting for surgery. We can't add any more treatments for a patient who is out of critical condition. He said, sadly, I understand. Just as expected. Dr. Shin, I have to check on other patients, so please complete the remaining steps. Yes, Professor. He left, but we continued to finish up. The emergency room lights are always on. All right, Dr. Lehman Ho, you have closed incisions in the year before. Have not you? I have done a few times. Then why don't you try with this patient? The professor asked you to close the incision. Can you do it? I want to see how skilled you really are. If it is too bad, I will take over. Got it. Dr. Lee, can you hand me the suture? What nylon 10? Everyone looks at him skeptically. What? Why do you need vascular sutures? I am going to perform a vas deferens repair. What? Are you out of your mind? Earlier, you acted like a know-it-all in front of the professor, and now you're losing sight of your position just because of a few compliments. It is a simple procedure that can be done quickly. He is young. Please let me do it. Simple. Are you kidding me? You think just repairing the vas deferens is enough? You also have to stimulate all the surrounding muscles. Do you think an intern doctor is allowed to do that? If I were the patient, I would have kicked you out immediately. I just asked to do it because I really can. I am not stubbornly insisting on doing something impossible. This is a surgery that I am sure I can handle. It would be a shame to give up like this. I am telling you again, please trust me. Everyone is confused. Oh my god. Then they look at each other suspiciously. Doctor. Shin narrows his eyes. He says annoyed, you are really stubborn. We do not have time. I will support you from the side, so get on with it. The kid excitedly said, thank you, sir. Then he skillfully sutured the vas deferens. He was extremely calm and serious. Inside the room, his colleagues were diligently assisting. Finally, he sutured beautifully even though everyone was still worried and looking puzzled. Are you crazy? Are you really an intern? My dream is to become a surgeon, so I have been practicing suturing a lot since high school. Even so, his suturing skills are even better than Professor Jiang Taiju's. How is that possible? He is just a nobody intern. Then he seriously said, "Cut." The doctor snapped out of his daze and replied, "Ah, yes." The incision was completed. Finally, the main character gave a faint smile. The clock ticked away. Time passed and the once bustling emergency room quickly grew quiet. The hospital finally became more stable, and inside the doctor's office, "Hayes, it was really tough. You did well. Specialist Dr. Shin," he said, "Hey, the intern doctor from your batch is truly exceptional. I am talking about Dr. Manhwa. Earlier, I performed surgery on a patient with an injury in the lower right abdomen with him, and he flawlessly executed the spermatic cord repair." Spermatic cord repair. Yes, I cannot believe it even though I saw it with my own eyes. That guy must be living his second life as a doctor at the very least. Be grateful that this department has someone like him in your batch. Ask him lots of questions and learn well. The two awkwardly said, "Minho is truly amazing." I know, right? The way he gets patients to open their mouths during intubation is amazing. I wonder where he learned such things. "Mr. Shin excitedly said, "All right, Dr. Cha, lie down on the bed for a bit." He complied and asked why. "What are you gonna do? Clench your teeth again?" "Yes, just like that, as if you're having a seizure." Then he mischievously said, "Is it around here?" "Eek, that tickles." Then he pressed hard and said, "Here it is." And the result was that the doctor got a neck injury. Is not it? "Wait a minute, Dr. Cha, this time I will get it right." Dr. Cha shouted in astonishment, "Help me in turn. Get back to work." Dr. Be on Dr. On. He kept pressing, making Dr. Cha scream, "Help me." The awkward atmosphere lingered. It was a peaceful day in the emergency department. A new day dawned at the hospital. The intern looked sad thinking back. Why did he suggest discharging a patient with tension pneumothorax? As if it were not chaotic enough. Dr. Bjorn always has to make things twice as difficult, does not he? Who told you that all symptoms of a patient admitted due to a car accident must be caused by the accident? The patient is complaining of chest pain, and the x-ray shows a collapsed lung. How can you say you do not know? I am sorry. Even as an intern, they're unforgivable mistakes. But Dr. Lee Min-ho, your colleague, did very well. What exactly is Dr. Bjorn's problem? Tears falling maybe. The floodgates have burst. Bjorn thinks, is it because I am not talented? Inside the emergency exit, Maine staggers after being busy treating patients until dawn. Even I feel exhausted. Even so, it is a relief that the situation was resolved quickly, and there were not many critical patients. When we get off work, we should practice breathing. When you went up at a rooftop, you saw a kid standing there. Doctor. He was startled and responded, "It is Min-ho." "Doctor, are you also out here to get some fresh air?" He looked worried. He did not seem very well. At that moment, Dr. Shin entered the doctor's room and praised him a lot. "I am so jealous. I just get scolded every day." So he's upset because he's been scolded. Now just examining patients makes me terrified. Will I make a wrong judgment and get scolded again? Maybe this path is not right for me. Are you so scared of being scolded that you can't even examine patients? And if you get praised a few times, will you be able to examine patients better? What? Patients come to the hospital for different reasons. The praise or scolding from your colleagues is irrelevant to the diagnosis, is not it? If I make the right diagnosis, the patient can receive the correct treatment more quickly. But if I make a wrong diagnosis, the patient will suffer for a longer time. But you're saying you can't make a diagnosis because you are afraid of being scolded by your superiors. You've got the issue backwards. Is not that right? In the end, Ben, though sad, also realized. Of course, no one likes to be scolded. Me too, when I started my medical career. How many different scoldings did I receive from my superiors? But if you were scolded because of your own lack of skills, you should accept it and study harder. Because it is a matter of life and death for the patients. You can't just let things slide. Right? Moreover, since we're still interns, even if we make mistakes, the resident doctors can fix everything. So you can avoid trouble, can't you? You're right, Minho. Something I have forgotten just came back to me. Then he hesitantly picked up his work badge. When I first dreamed of becoming a doctor. I just want to treat the sick. Time passes by. Young man may wear a doctor's coat, but he is not happy inside. After starting my internship, I kept getting scolded by my superiors, cursed at by patients, and overwhelmed with work. Because of that, I forgot why I started this job in the first place. At Seoul University Hospital, why did I want to become a doctor? But I realized it again after talking to you. I wish patients would not have to suffer. I want to help them go back home. Maine replied, then that is a relief. Instead of feeling discouraged by the scolding, I need to pull myself together and study even harder. What wrong have the patients I treat done? Looking at his mindset, I am sure he will push himself to improve. Someday, he will become a great doctor. To be honest, I kept being compared to you, so I felt a little annoyed with you too. Anyone would feel that way. I did not want to treat you like a fool, but Ben felt grossed out saying, the way you talk is exactly like my grandpa. Maybe you're just imagining it. After, that it kept raining non-stop, so the two brothers went inside. Still inside the hospital, the two of them finally laughed happily together. Mr. Shin rushed and panicked, saying, Dr. Lin Min Ho, come here. Can you show me again what you did when you opened Shin Dong Chul's mouth? Ming looked confused, asking, what are you talking about, Dad? I tried practicing on Dr. Cha, but it did not work. That is why you can't turn your neck. Can't you ask Dr. Shin for help? Ming grabbed Dr. Cha's neck point and said, turn this way for a moment. Oh, your neck is back to normal. Mr. Shin looked longingly at Dr. Cha's neck and said, what? How did you do that? I want to try to. Dr. Cha said fearfully, do not touch me. CHHH. Then they chased each other around the hospital. Coward. When stimulating the acupoints, you need to use more hand force, strong enough to temporarily paralyze the nerves. Mr. Shin said sadly, even when I did that. Let me show you. Then Maine rummaged through his bag. He pulled out a walnut. Yes, sometimes when I am resting, I roll a walnut in my hand to massage my palm. Now look. He presses lightly, and the walnut shell cracks. You need to press this hard. Mr. Shin hesitates and says, right, that is the difference in strength. Lie down here. In the distance, someone is being helped into the hospital. What happened to him? He said he fell off his bike while delivering, slipped on rainwater. Did you collide with a car? The patient replies, no, but when Maine sees the patient's injury, he is terrified. My thigh was scraped hard on the asphalt. Looking at this wound, it seems quite serious. Can you try moving your toes? Yes. Then he cuts the fabric around the injured area. The patient screams in pain. Does it hurt? How about here? It hurts everywhere. On the surface, the wound seems to be a simple laceration. Luckily, the bones and nerves seem intact. After removing the foreign object from the wound, I will disinfect it. Before that, to prevent any bacterial infection, I will give you a tetanus shot first. Patient compliantly responds, okay. After that, everyone carries out their professional duties. A voice rings out, Dr. Limonho. Dr. Shin smiles lightly and says, do you want to try handling the wound? Main character looks over, smiling excitedly, then he proceeds to work for a while. To completely remove the foreign objects trapped in the skin, I will wash it with high pressure. Even though he's anesthetized, it is still quite painful. Patient looks reassuringly, I am good at handling pain, so do not worry. Oh my god, even after just falling off his bike, he is more worried about the delivery than himself. Luckily, I happened to be at the scene of the accident. Otherwise, he would have made the delivery first before going to the hospital. Then Maine used the device to clean the wound. He sucked and flushed the wound with saline solution and disinfectant. Try not to ride your motorbike on rainy days. It is dangerous. I have to make a living, so I have no other choice. I try to ride carefully, but just a person came up and said, this guy has a little daughter, and he has to work day and night to raise her alone. If he keeps going like this before his daughter starts elementary school, I keep telling him to take care of his body so he does not die before then, but he is so stubborn. TSK. Come on, my friend. Being a father is tough. In a past life, I saw many patients like this. Recalling the previous life of Mr. Maine, a panicked person ran up and said, Master, is this the herb you mentioned? Yes, that is right. But how in this weather? I searched all over the mountain to find it. Please cure my child. A parent's heart, whether then or now, is the same. Holding the clamp and needle. After receiving the clamp and needle, Mr. Maine continued his actions. No matter how many times I see it, it is still amazing. A tear over 10 centimeters long, yet he managed to perform it smoothly with a mattress stitching method of suturing, where both the deep and superficial layers of the skin are stitched together using a single thread. He is the best stitcher in our emergency room. Do not worry. It won't leave a scar. Yes, thank you. I do not know the details, but he seems very skilled. Maine stitched it to the very last drop. Oh, cut it. The wound has been thoroughly treated, so you will recover quickly. The patient thanked the doctor profusely. I understand how you feel. But how do you think your children would feel if they saw you injured? So please try not to deliver packages on rainy days. Spend time with your children. The next morning at the hospital, the main character strikes a confused pose, then a babwa formation appears before his eyes. A Taoist technique designed for human physiology. Although this is a rare day off, instead of just resting, regular practice will be more beneficial for his physical health. There's some movement outside. When he opens the door, he sees a gift box in front of the house. Who sent this? Sent from Gohong City. Cinder, Myong-soon, Myeon-soon. An image of a person immediately comes to his mind. It is Dr. Lee Min-ho's mother. Maine opened it and curiously asked, what did she send? This is Jin Maki dried squid strips. I have had it a few times at the cafeteria. So delicious. It is on a completely different level compared to what I have had at the restaurant. Her cooking skills are amazing. Is she a chef at some official residence? Call coming in, Mom. Hello. A voice echoed. Oh, Minho. The side dishes must have arrived. Did you receive them? Ah, yes. I just received them. Oh my goodness. Now that you're a doctor, you're using honorifics that you never used before. I sing your favorite galba jim, braised ribs, and kimchi soup. Everything is in a thermal container. Eat it before it spoils. Do not save it. I understand. I will eat it well. Mom suddenly lowered her voice. Is life at the hospital still tough these days? I am fine. My superiors praise me a lot and my colleagues and resident doctors treat me well. Oh my, what a relief. You have no idea how much I worried about you. I am happy you have become a doctor, but you are always my top priority. Please work while thinking about your health. Okay. Yes, Mom. Do not worry. When Maine turned off his phone, he hesitated a little. Oh my, I feel unnecessarily guilty. I did not forcibly take over Dr. Lee Min-ho's body. It is not like I could have saved Dr. Lee Min-ho at that time, Samin at Nutrien Herrig. I do not even know why I came to this era. All I can do is live more diligently, so as not to bring shame to Dr. Lee Min-ho and his family. I will not tarnish their reputation. I do not even know why I ended up in this era. By the way, how should I deal with all this if I leave it at home? It will definitely spoil before I can finish eating it. I should take some of the hospital and put in the fridge. That way, we can all enjoy together. Then the scene shifts to an office in the hospital. Bong Se-gil, the head of the emergency medicine department, says, I heard you received a large number of traffic accident patients yesterday. Dr. Shin, looking rather displeased, replies, yes. The department heads kept calling me non-stop. It was hard to ignore them. I did not expect to have to call head Bong, but I apologize. I know Professor Jang came at the director's request, but while you're still in the emergency department, I want you to go through me. If you had told me first, I could have explained it to the other department heads. Would not that have been easier to resolve? Because you had the day off yesterday, I tried not to bother you with hospital matters, but my thinking was too shallow. I sided with Professor Jiang, but Professor Jiang is not even from this university. He reminded me to just pay a little more attention. You can go now. Yes, Doctor. Shin left feeling dejected, and as he left, he felt heavy-hearted. This head doctor is a bit strange. As Dr. Shin left, he kept thinking, I did not mean to come across as arrogant. From the department head's perspective, he might have felt ignored by me. Since the first day at this hospital, he seemed to dislike me, but look at that old man's face. Does he see me as a target to be wary of? Professor, the preparation for the room is complete. Mr. Shin smiles at the professor. He says, all right, let's see. First, patient Shindong Chul. Dr. Shin, I told you to just finish up with patient Shindong Chul, and you mentioned the spermatic cord. Ah, that, because he's a young male patient. I understand. I thought this part might still be too much for Dr. Shin, but you did quite well. You seem to be practicing very hard. This doctor says, yes, that is right. However, he is very suspicious. Then the professor says, well then, shall we check on patient Shindong Chul's condition first? A professor at this moment, Dr. Shin hesitates. Then he says, actually, it was done by Dr. Lee Min-ho. Scene transitions to another place. Suddenly, message arrives in the mailbox. The computer screen shows an attached file. The message reads, I am sending you the recording of the surgery in room 2, around 8:10 p.m. last night. Professor Zhang is working diligently. And on the screen is an image of the operating room. Maine is performing skillfully. He looked on in astonishment and said, no way. With evenly spaced movements as if measured with a ruler, his hands moved gracefully like they were dancing to a rhythm. How could he be both so precise and so fast? Look at how the main guy is stitching the vast deference. Is this really the skill of a medical intern? What the hell is this? He could not believe it and said, what has the CS department done to Dr. Lee Min-ho? Could someone really improve their skills to this level during an internship? No. Even if they train him all night, he could not be this good. He thought a natural-born genius. Did not they say the CS department had already targeted him? He smirked and said no way. By all means, Dr. Lee Min-ho must be brought to our trauma surgery department. Unlike Mr. Zhang, Min is looking confused. He stares indifferently at Dr. Lee Min-ho's mother's food, even though he brought it with good intentions to share with everyone. He painfully thinks, did not expect it to be gone in just a few hours. Min-ho, your mom's cooking is the best. Make sure to tell her I really enjoyed it. I was in so much pain, I kept thinking in circles. Is it enough that they just enjoy their meal? Suddenly, the doctor noticed me. When he saw me cleaning up the dining table, I called out loudly, Dear Lee Min-ho. Then he said, Chief Bong is looking for you. I snapped out my days and thought if it is Chief Bong. The noise around me made me curious. This morning, I just ran into Chief Bong. Lately, when he's not around, then shows up again. There's a rumor that I am waiting for Professor Jiang. Who on earth went and taffled like that? Who else was Dr. Moon, Seong, Ryong, like a chick following its mother, hen, all day long. He just trails behind Director Bong. That doctor, Hayes, anyway, we are the only ones suffering stuck in the middle. You wonder, they're not even animals. Are there really people involved in territorial wars at the hospital? You seriously think about it for a while. I think it's someone from last time. Why did you suddenly come looking for me? The head of the department is over there. He's talking to everyone in the department. Main's voice rings out. I heard you were looking for me. I thought you were in the clinic, but it turns out you are here. Suddenly, he laughs unpleasantly and says, all right. Just as well, I have an urgent matter to discuss. In his mind, he thinks, is this the guy named Lee Min-ho? Transition to the office, he says, Dr. Moon, look at the file of the patient admitted yesterday for subarachnoid hemorrhage SAW. They only did a CT scan and immediately transferred to neurosurgery in S. Why did not they do other tests? Moon Seung Ryong, the chief resident says when I asked Dr. Shin Hee Cheel about it. Dr. Lee Min-ho suspected SA after seeing the symptoms. He said he requested an immediate brain CT scan. Lee Min-ho, I have heard that name somewhere before. His memories flashed. The scene was chaotic and confusing. He went crazy calling on the phone. Oh my, I tell you, you're lucky to be alive to know our patient was transferred. Do not tell me the patient had a cardiac arrest and was targeted by Professor Huang and Bao. Did that guy examine this patient? This was not a minor case, and it was a suspected patient, right? It seems Professor Jiang also had that intern doctor examine the patient before as a test. Even then, he diagnosed ovarian torsion just by palpation. Even he was amazed, asking how it was possible. Did he come from a family of doctors? Dr. Shin said he had dreamed of becoming a doctor since he was young and had studied a lot. His parents were ordinary farmers in the countryside. What is even more amazing and surprising is when he was in the CS department under the supervision of Dr. Oh Gukwan. He even completed a few surgeries. When the main character meets the department head, someone suddenly says, a 47-year-old man fainted at the subway station. He was found unconscious by a station employee, who then called for an ambulance. When we arrived, he had somewhat regained consciousness. Then the department head Bong turned to the main character and said, Dr. Lee, why don't you try diagnosing him? I understand. No matter how much one studies, diagnosing a patient and giving medical orders is not something everyone can do. What is your name, sir? The old man thought. Professor Jiang is trying to pull Dr. Shin towards the trauma surgery department. I am tired of seeing that. Having a talented intern on his side soon would not hurt. Right. The main character calmly asked, have you ever fainted like this before? No. My annual health checks have always been normal, so I do not know why this suddenly happened. The patient's blood pressure is 85/60, pulse 120 beats per minute, respiratory rate is 15 breaths, and SpO2 is 98%. Low blood pressure, but rapid pulse. That indicates more accurately a pre-shock symptom. These are symptoms that occur when a blood vessel somewhere in the body bursts and there is not enough blood. We need to stabilize his vital signs first. Main, give the order immediately. Hang 1 liter of normal saline and infuse quickly at 300 drops. Everyone around was surprised, but still follow the instruction. Yes, understood. Were there any warning symptoms before the patient lost consciousness? Before fainting, did you have a headache, chest pain, or shortness of breath? The patient replied. It was just that my vision went dark. The pulse at the Higu point is irregular, and his face is pale. The promontory symptoms are very clear. It seems like gastrointestinal bleeding. Your eyes show a bit of worry. You glance at the 2 department heads behind. Then you lower your eyes and think so. Please prepare for an electrocardiogram first. If we insert a gastric tube to check the blood, we can diagnose the condition immediately. Mr. Bond leans closer and says, you have administered all the saline. It seems highly likely it is shock due to hypotension. Yes, since his consciousness is still alert instead of the brain or heart. I suspect there is bleeding in the gastrointestinal tract. Mr. Vong is surprised. You are too hasty, Dr. Lee. This patient was admitted due to fainting and has pre-shock symptoms. You need to consider and differentiate between SA, aortic dissection, and pulmonary embolism. If it is SA, severe headaches usually occur before fainting. If it is aortic dissection or pulmonary embolism, at least there would be respiratory failure. None of those symptoms are present, and his consciousness is still clear. I think it makes more sense to consider this as orthostatic hypotension due to gastrointestinal bleeding, rather than a cardiac cause. Main confidently spoke, leaving the doctor next to him speechless. A nurse rushed in and said the ECG results were ready. The 2 elderly doctors looked at the results and were utterly shocked. Main smiled confidently and said, well then, shall we? Go for the examination. After that, they proceeded with the examination. That doctor did not believe it, so he replaced the main guy. There is no sign of internal bleeding in the abdomen, liver, or spleen. It is most likely bleeding in the stomach or colon. Dr. Lee Min-ho, where do you think the bleeding is coming from? It seems to be caused by a duodenal ulcer. The main guy said, Doctor, go. Please prepare a nasogastric tube. Yes. Then everyone proceeded to treat the patient. First, we will insert a nasogastric tube to suction the blood clots in the stomach and clean it, then locate the bleeding site and perform surgical measures. You need to breathe naturally. Open your mouth a little wider. If the tube passes through the nasal cavity and into the throat, it is very likely to enter the airway. We need to properly direct the tube towards the esophagus. In that state, swallow the tube as if you were swallowing saliva. The old man assessed that he handled the patient quite leisurely. Then, Main administered the infusion. Blood pressure is 115/0. Pulse is 96. Currently, his vital signs have stabilized significantly. The bleeding must have stopped. The bleeding has temporarily stopped because the cold irrigation fluid has entered, but bleeding may recur if the blood pressure rises again. I think we need to inform the internal medicine department quickly to find a bleeding site. Mr. Bong said, go ahead. Then he looked at Main, Dr. Lee Min-ho, come in my office for a moment. Just as expected, what is coming has come. Inside the department head's office, the old man looked at him with interest and said, do you like black tea? Yes, I do. Sweet and fragrant. It is great. I've heard a lot about Dr. Lee's skills, so I tested you. You were even better than I expected. It is not easy for an intern to give accurate orders and place a gastric tube just by learning. He calmly replied, thank you for appreciating me. It is almost time for you to choose your specialty, is not it? Have you thought about which department to choose? He smirked, thinking, so that is his intention. I am considering surgery. Oh my, do I really need to put myself through unnecessary hardship? You know, as a human being, work is important, but balancing it with your life is equally crucial. It seems you have forgotten that this is just as important. When we go out to play golf with close colleagues, the professors from the surgery departments are noticeably absent. He played his card saying, why do you think that is? Mame replied, I can imagine. It can be rewarding, but your body will be exhausted. And above all, you might frequently get sued for medical errors. If you plan to open your own clinic, our emergency medicine department would be a much better choice. He looked at you like a juicy prey and said, if you choose our department, when you become a specialist, I will shorten your advanced training as much as possible so you can be appointed. He is offering me an appointment to a mere intern. Intern Lee Min-ho. You were shocked, thinking no matter how good my skills are, this is an excessive offer. An offer beyond the norm usually has a reason behind it. This has little to do with his desire for me. It seems he does not want Professor Jiang Taeju to benefit from me. However, I have seen many second faces of those in power. They will entice you with sweet words when they need you, but if you go against their will even a little, they will discard it mercilessly. I am starting to understand how everything works here. For now, it is best to go with the flow. You pretended to speak cheerfully. I really appreciate your offer. I will consider the emergency medicine department as my top priority. Scene transitioned to the emergency department. While working at a factory in Ilsan, his abdomen and leg were crushed by the wheels of a forklift. There was severe internal bleeding in the abdomen, and the leg was fractured to the point where the bone was visible. He had lost consciousness by the time we arrived. Professor Jiang quickly said, we will need to collaborate with the orthopedic department, OS Orthopedic Surgery. Doctor, you and Dr. Lee, you two will assist me. Find out the patient's blood type and warm the blood bags beforehand. Everyone focused 100% and said, yes. The main character also participated in this urgent emergency case. Tom ticks away. Everyone outside is extremely anxious. The danger ahead is probably past. At least the orthopedic team is almost done. As for the surgery, I wonder if he will let Min-ho handle closing the incision. I am so curious. He's been watching Main and thinking, after all, with Min-ho's skills, just how talented is he really? Turning back, the big guy said, we will proceed with the blood test right away. So please wait a moment. All right. A voice groaning as if about to die. Dr. Cha. A face wrinkled like a monkey's, but says, can I use the restroom? You are at that point already. No need to ask. Dr. Cha wordly says, okay, go ahead. He cheerfully says, yes. Just take a quick look, so I won't be late, then come right back. He heads to the operating area. The doctor orders, irrigate, suction. Everyone hears the command and executes without hesitation. Next, irrigate again. The abdomen is wide open. Damn it, I can't tell where the blood is coming from. We have stopped the bleeding in the major vessels, but bleeding in the smaller vessels is the problem, usually in cases like this. We have seen this often in cavalrymen who fall off their horses. An injury on the right side, but organs on the left side, are also damaged. Main looks in and worries. Look at the abdomen and the small capillaries. Then his eyes light up. Professor, I see some minor bleeding near the liver. The connection between the inferior vena cava and the gallbladder. Maine said. Yes, I see a stream of fluid flowing near the Cantley line of the liver. The professor, looking serious, thought, if it is the Cantley line. He worriedly thought, could it be bleeding from the middle hepatic vein? Then I will extend the incision toward the liver. After that, they immediately took action. The subhepatic incision was opened. Dr. Zhang seriously and carefully proceeded, and then he was truly shocked. There is something wrong under the liver. Maine looks at his boss's expression and feels satisfied. Prepare the suture to expose the blood vessel inside the video room, and in turn sneaks in. He's surprised to see his colleagues there too. Jisoo, why are you here? What about you? Well, actually, I was curious to see if Professor Zhang would choose Minho. Speaking of which, he was just assigned to handle the suturing. She hesitantly said, I also came a watch. Really? Yes, she replied, and it is even. The intern did not pay attention to her words while he was utterly amazed looking at the screen, the technique, and the images in the video. Peritoneal suturing. No way. Suturing the thin, smooth peritoneum is several times harder than suturing skin. He did not panic at all in front of the professor. He even found the bleeding spot that the professor could not locate earlier. With the skills Minho has demonstrated so far, perhaps it is not just luck. I think so. His friends felt disheartened, thinking, never thought I would feel so inferior to someone like that. How embarrassing, he awkwardly said. Even though we are in the same class, the more I look at Minho, the more I realize how amazing he is. Then both of them were awakened by the sound of a phone ringing. Yeah. Yes. Dr. Cha. Yes. I just came out of the restroom. Yes. Dr. Woo. Yes. I am on my way now. Maine took the final step. How are the patient's vital signs? 110/2, 80/20. He has been much more stable since he got through the critical moment earlier. The surgical team breathed a sigh of relief. Dr. Zhang said, what a relief. Looking at the patient in front of them, if we had kept him for tests, this patient would have died before even reaching the operating room. Thanks to Professor Zhang, Taeju's quick judgment, bypassing the fracture examination and heading straight to surgery was a heaven-sent decision. At this point, it is safe to say Professor Zhang Taeju saved this man's life. His ability to handle emergency patients is definitely the best in this hospital. Professor, you have worked hard. Dr. Lee Minho, you've done a great job too. Your suturing skills seem even better than what I've seen in videos. I will soon let you handle an appendectomy case, so study up on appendectomy surgery next to an annoyed person speaking professor. Dr. Lee Minho is still intern. He is better than most chief residents. So is there a problem? No. He interrupts. Anyway, his internship will end in a few months. Isn't that right, doctor? Hey, someone at Dr. Lee Minho's level is more than capable of performing an appendectomy. Right. His skills are more than adequate. Though Professor Jiang will have to supervise, he gives a thumbs up in response. That is a given. He looks satisfied, and said to Maine, Dr. Lee Minho, are you confident that you can successfully perform an appendectomy? His eyes were full of excitement. His cheeks flushed. He immediately responded, of course, sir. Since you are so confident, I will make sure to give you the opportunity as soon as possible. Professor Zhang thanked everyone and said, well then, everyone has worked very hard. He left without hesitation. Man was overjoyed and thought, finally. He looked at the patient with excitement. I finally have the chance to lead a surgery. Another day passes the next morning at the hospital. A staff member appears and says, here is your Hawaiian tropical juice. A person in a floral outfit takes the glass. The old man drinks it with great pleasure. While enjoying it, his eyes widen, wondering how he knew I had just arrived in Korea and called me immediately. He answers the phone unhappily. Hello? Chief, did you enjoy your vacation? I had a long and beautiful vacation. Nothing happened while I was away. Right, Professor Kim was very busy, but there were no major issues. Oh my god, I bet he performs several major surgeries every day. I understand how he feels, but if he overworks himself, he will regret it later just like I did. TSK. That is right. Professor, since you have been away from the hospital for more than just a day or two, think about the future and work moderately. The old man said tiredly. I get it. By the way, Chief, do you remember the intern named Lee Minho? I remember him. Why bring him up all of a sudden? Did he cause trouble again? No, Professor. Quite the opposite. Lately, there have been a lot of positive rumors about him in the hospital. This even shocked him more, he said. What? He looked completely baffled and asked who would even spread positive rumors. He cut to the main character at the hospital, happily poking a patient's belly. The main guy sits dazed in the waiting room. Turns out Mr. Maine is addicted to studying people and is watching a laparoscopic surgery video. It is an appendectomy procedure to remove the appendix when it is inflamed. Its official name is appendectomy. In the past, I saw patients come to the hospital with appendix issues. Back then, we had to make a large incision in the abdomen, leaving the patient with a lifelong scar. In modern medicine, using a camera and tools called laparoscopes, we can make only minimal incisions. First, we observe the inside of the abdominal cavity with the camera and remove the inflamed appendix. Elsewhere, there is chatter, Professor Jung Tai, Ju promised doctor, Lee Min-ho, an appendectomy case. Yes, I heard it myself in the operating room yesterday. It seems Professor Jang really trusts Dr. Lee Min-ho. Well, he deserves it. Jisoo says, that is amazing, Min-ho. He is just an intern, but he already has the chance to perform surgery. The gap between Min-ho and us is growing wider. I have never seen an intern with achievements like this. Is he some kind of monster? Dr. Cha, still bewildered, says you think so too. Even Dr. Shudva started to get curious. I wonder how good he really is. While Main is immersed in surgery videos with passion and love. Inside the room of a department head, someone walks in and asks, did you enjoy your vacation? It was a good time, but I heard something strange from Professor SEO. Do you know anything about it? Something about internally, Min. Apparently, he received a lot of praise while I was away. He smiles and replies, ah yes, he came back a completely different person overnight. I used to think he was incompetent, but on the contrary, his suturing skills are even better than the specialists. The old man laughs in disbelief. Are you saying the kid could not tell if a patient was dead or alive? At that moment, the situation was too urgent, so we only performed basic procedures in the emergency room and hurriedly took the patient to the operating room. For a busy intern rushing with a stretcher, is not it very difficult to recognize a cardiac arrest amidst that chaos from the beginning? That is not something an intern should be held responsible for. The old man angrily said, so are you trying to say that I imposed an excessive punishment? The young doctor responded quickly, oh, no, doctor, it was the patient's family who overreacted. CS, thoracic cardiovascular surgery. According to Dr. Song Godr, Lee Min-ho announced in front of the residents. CS, thoracic cardiovascular surgery, that he would apply to the department. What? The old man said angrily, why? The young doctor responded, I am wondering the same thing, but our department is already one that people avoid. If a rookie with that level of skill joins us, we should be grateful. After being treated so poorly, he is still planning to apply to our department. Is that bastard trying to provoke me? Does he think I will accept his application? The junior hesitates and says, Sir Dean, do not get your hopes up. Even if we were short on applicants, a resident brought a dead body into the operating room. I have no intention of accepting him. Scene transitions to the operating room, starting an appendectomy. Dr. Lee, you may begin. The main character nods in agreement. The scalpel is handed to the main character. He takes it and makes a clean incision. After that, he is completely focused, going deeper and deeper. Professor Jiang quietly watches for someone holding a scalpel for the first time. His calm demeanor is truly astonishing. He must have practiced a lot. Then the nurse brings the equipment to Main. The surgical environment is much better than in the past. Now, just need to separate the appendix from the mesoappendix. First, stabilize, inflate, and clamp the tissue with the dissecting forceps. Cauterize the connection to the mesoappendix with bipolar electrocautery, then tie off the base of the appendix with a suture. Everyone unconsciously looks at one point. It is the hospital timetable. He frowns. Anesthesia ended at around 4:03, and the surgery started around 4:05, but he already had his appendix removed. I see. Thanks to Dr. Lee Min-ho's quick incision, the surgery did not take much time. Suddenly, Main took out something that surprised everyone. There's also a string in your friend's stomach. Main spoke up, Professor. I think this is a mucinous appendiceal tumor size, about 30 meters. Mucinous appendiceal tumor, a benign or malignant tumor arising from the vermiform appendix. After hearing this, the old man had to take another look. The items on the tray you are holding, observe them carefully before drawing any conclusions. After looking, you feel satisfied and think sharp eyes. The professor immediately orders, Dr. Shin, please take the specimen to the pathology lab and request a tissue biopsy. He responds, understand, sir. After that, Dr. Shin hesitantly walks away. Main watches him leave, feeling touched, and thinks, I should have been the one to request the biopsy. It seems like he is letting me focus on stitching the incision. The professor says, although the mucinous tumor is not large, it might have ruptured, so I need to examine the surrounding structures as well. Ming replies, I have already checked everything on the screen throughout the surgery, sir. Is that so? He meticulously checks everything on his own without needing any guidance. Such remarkable focus. A moment later, Shin-chan walks in and says, here are the test results. The professor reads the results and says, it's a benign tumor. We can finish up now. Main confidently replies, yes. In that case, I will start closing the incision. A moment later, they cautiously step out. The professor looks at him satisfied and says, you did great today, Dr. Lee, thanks to you. The surgery went very smoothly. You're too kind, doctor. Then he slowly walks away. Man lets out a sigh of relief. He touches his heart thinking like a weirdo, oh my god, my heart is pounding. So excited, feeling strangely elated. I do not know how long it has been since I felt the joy of healing people. Just participating in an appendectomy makes me feel this way. I am so grateful I can continue. Surgery addict thinks, since today's surgery went well, will I have the chance to join another surgery next time? Then transition to a sumptuous dinner table, looks delicious. Main guy drools while his friend judges. You react like you have never been to a buffet before. Are you planning to buy all of this? Beautiful Jisoo looks at him and replies, I told you I would treat you. The main guy turns his head, looks at the food in front of him and says, alright then. He rushes to grab food as if joining a survival battlefield. He's extremely proud of his spoils. 2 of your friends sprayed adhesive and froze in place. Then the group made some quick notes, and before you knew it, they were back at the hospital. Scene transitions back to the hospital, and at this moment, a voice is heard. Minho, can you help me for a moment? She is a 77-year-old female patient who said she took cold medicine yesterday because she was feeling aches and pains. But her cold symptoms worsened and she started experiencing chills, making it difficult for her to move, so she called an ambulance. Main character picks up the medical chart and looks it over. Conscious. Blood pressure, 100/60, pulse 70, respiratory rate 24, 38.6 degrees Celsius, pupils 4/4, normal pupillary reflex. Also has a fever and unstable breathing. You ask her, suspecting sepsis. I also suspect sepsis. Receive the results in hand. Here are the blood gas test results. The results show elevated liver enzymes, cot/point and bowel pigments, highly likely to be cholecystitis or cholangitis. When Dr. Wu Hai palpated her abdomen, there was no pain or rebound tenderness. You calmly reply, she's an elderly patient, so she is on beta blockers and digoxin for atrial fibrillation, so she probably won't react to common pains. When performing abdominal ultrasound, if you focus on the bile ducts, you will definitely see abnormalities. Then transition to the interns pulling each other to check. Looking over, she thinks there does not seem to be any particular abnormalities. Beautiful Jisoo adds, Doctor, it looks like there is a gallstone in the bile duct. What? After moving through, there were indeed a few rocks. The specialist doctor was surprised and said, is that really true? Quite impressive. Dr. On. Thank you. That is why we gathered at the buffet today. I told you not to take too much. At the hospital and at the restaurant, Jizzle looked at Maine and thought with a sweet smile. He is a completely different person. Transition to the calendar. Finally, the Mid-Autumn Festival Chuseok has arrived. Professor Jeng thought sadly, by choosing trauma surgery, I have never had a holiday or summer vacation while everyone else is resting. I have never had a break, not even once. Surely, this time will be the same. She will put a lot of pressure on me, because she has to go back and forth between her parents' house and ours alone. Thinking about my shark, he feared, at this rate, I will end up being carried back here as a patient. My wife is one thing, but the emergency room is already busy. How much busier will it be during the Chuseok holiday? He painfully thinks, if only Dr. Lee Min-ho were a second-year resident, I would have one less worry. Next to the ringing phone, hello, Professor. There's been an accident at a residential construction site. The patient is currently being transported to our hospital. The professor asks worriedly for what height did he fall. He fell from the 3rd floor. A rebar pierced through his abdomen and protruded from his back. His ribs also seem to be broken. Thanks to the helmet, there is almost no head injury, but the patient is currently unconscious. The professor stands up worriedly and says, damn it, I will contact the CS department first. So call the anesthesiology department and ask them to prepare an operating room immediately. Got it. After that, the emergency department team is fully present. The main guy looks around in confusion. An old man approaches, and he turns to see who it is. Then he is surprised thinking, is that Director Huang and Bong? As he looks at him, his body freezes up. The old man's voice echoes once again, in turn Lee Min-ho. Until the lawsuit is withdrawn, you'll be on night duty indefinitely. The horrifying scene reappears. The main guy drifts through the hospital like a ghost. This time, he looks over uncomfortably. That is right. That must be Director Huang and Bong. If I remember correctly, he is the type who bows to his superiors and tramples on his subordinates. A typical petty man. Next to the polite professor speaking, you are here, Dean. How do they train interns in the emergency department that even the dean does not get greeted? The professor looks confused and asks back, what? I mean this in turn. Then he directly points at Maine for Var. Dr. Lee, you did not greet the dean. He immediately replies, I did greet him. He feels extremely annoyed and thinks, actually, I did not greet him. Whether I greet him or not, he will still find fault anyway. He won't let it go easily and says, I do not recall receiving any greeting. Even if you did greet me, I did not see it, so you should do it again. How dare you look directly at me? He snarkily responds, it's been a while since I've seen you. So I looked because I was happy to see you, sir. This time, Maine smirked and said, but if I greet you twice, is not that the ritual for greeting the deceased? The old man heard this and got angry. What? Even the professor next to him was wide-eyed. The old man shouted, "Dr. Lee." The people behind were gossiping, "Whoa, doctor. Lee is not to be underestimated. Yeah, he has that side too." Amidst the commotion, the ambulance rushed in urgently. Professor Jiang immediately ran over. Inside the ambulance, the stretcher and the patient were brought out. Looking at this scene, everyone wanted to meet Sister Hugh. The emergency doctor took one look at the patient and immediately sprang into action, inserted a central line, administer saline quickly, flush it, just pour it in, blood pressure 90/59, pulse 89. We will know for sure after the CT scan, but from the X-ray, it seems the ribs and the chest area have punctured the lungs and heart. We will need to use ECMO, extracorporeal membrane oxygenation. It is best to prepare it now. If the situation worsens, we will need to use it immediately. Then there is no time for a CT scan. The steel bar has also pierced the stomach, tearing the pancreas and spleen. The fact that he is still alive is a miracle. For patients like this, the post-surgery mortality rate is very high, so it is better not to operate unless absolutely necessary. I will open the chest and then switch shifts with Professor Kim Joo-hyuk. Is not Professor Kim in surgery right now? They said it is a difficult case and will take at least 4 hours. Be confident, Chief. Are not you considered the best thoracic surgeon in the country? The old man immediately objected, saying, "If Professor Jiang gets sued a few times, you will understand how I feel." But Professor Jiang did not give up, saying, "If Professor Kim does not come, are you planning to give up on this patient?" Looking at the patient struggling to cling to life, the old man hesitantly said, "That is not it. For now, I will have to try a few things." The professor issued an order, "Move the patient to the operating room. Dr. Shin and Lee assist in the surgery." Both responded obediently, "Yes." Only the department head shouted, "What? Are you planning to use and in turn to assist in such an emergency surgery? If necessary, I will support you with doctors from our department." But Professor Jiang calmly replied, "Dr. Lee Manhwa is enough. I appreciate your kindness." He looked at Maine uncomfortably and said, "If Professor Jiang has said so, I won't say anything more, but later, do not regret it." The professor just smiled lightly at you. "Yes, the patient has been brought into the emergency operating room. The patient's vital signs are being maintained, but once we open his chest, blood will gush out and it will be chaotic. Keep the suction device near the scalpel. Even with protective goggles, if blood splashes, your vision will be obstructed." "Yes, understood. Anesthesia is complete. I will begin the surgery. First, we will remove the metal rod, then expect blood to spurt out like a fountain." The doctor reached out to block it. The two looked at each other, nodded, and praised each other. "Good reflexes, kid." Command given, clamp. Between two blood vessels clamped securely, the bleeding is gradually being controlled. At this point, the rebar can be removed. He slowly pulls up the gigantic rebar, pulling it just enough. This time he commands to pull out completely. Yes, the two of them together hold the long steel bar. As they pull it out with a pop, some fluid follows. The strange object is placed on the tray. The main guy glances at the lead worker. Professor Jiang is focused on his work. Seeing the patient's bone piercing straight into the organ is terrifying. When will Professor Kim Joo-hyuk arrive? If delayed any longer, we might have to put him on ECMO. He turns to the main guy and says, "This is not enough. Give another dose of heart stimulant." He immediately says, "Yes." He then turns to Dr. Hong. "I will cut the pericardium and remove the rib fragment. So as soon as I pull it out, place the suction head into the pericardium and suck the blood." "Okay." Then the doctor grabs the bone fragment embedded in the patient's heart. Blood spurts out, splashing onto the professor's face. Looking at the pristine white monitor, the main doctor beside him worries his heart has stopped. "Should we start EMU?" The professor says. "Wait." He hurriedly gives orders. "Dr. Hong, push the suction machine further to the right." "Got it." The suction tube is inserted efficiently, removing the fluid that is flowing out. Huang and Bong. Despite that, as a department head, his judgment and skills are undoubtedly exceptional. The doctor looks in a gap and says, "Fortunately, the rib fragments did not pierce the heart muscle, so we can stitch it back as it was." He orders, "Stitch the heart." The instruments are immediately brought closer. The professor intensely starts stitching it back together, then he ordered a cut. Finally, he let out a sigh of relief. He reached through the gap in the patient's body and grasped the heart to pump it. Maine looked on in amazement. It was heart massage. He rhythmically pumped and pushed, watching the doctor directly hold the heart in his hands. "I never thought I would witness something that even thoracic surgeons rarely see in their lifetime. Truly a delicate technique. I do not know what kind of person he is, but his skills are truly remarkable." Is it true that he avoided surgery because he was afraid of being sued? Next to the heart, the ECG gradually showed signs. Gradually, there are small and intermittent heartbeats. Then the heartbeats become clearer. The heartbeat is back. Everyone is extremely excited, so relieved. "Dr. Hong, give more heart medication." "Yes," just as expected from Chief Huang. His skills have not diminished at all, the old man said shakily. I tried to avoid getting involved if possible, but I had no other choice. By the way, this patient's vitality is incredibly strong. I just hope he wakes up safely. The group gathers together again. The doctor is performing the final steps. The professor commands, Dr. Shin, after you complete the bowel connection, Dr. Li will perform the vascular connection. Ming is surprised. Chief Huang and Bong is monitoring. Is it really okay? Ming receives the order and says, understood. What are you saying, Professor Jiang? Are you planning to let an intern perform the vascular connection? Doctor, Li Minho has enough skills to perform a vascular connection. Whether he has the skills or not, how will you take responsibility if the result is not good? I gave the order, so I will take responsibility. The chief yells, you're crazy, completely insane. Then he angrily yells in the room, not the patient's family, but I'll be the one to raise this issue. Even if he sides with you, I can't just let this go. On the contrary, the professor asserts Maine should conclude, Chief, if you monitor and think I made a wrong judgment, please bring me to the disciplinary board. Dr. Li, perform the vascular connection. Yes. Agreed. The main guy immediately gave orders. Doctor, please hand me the clamp and needle. Yes. After that, the main guy carefully reconnected the blood vessels. Chief Hong watched him like a hawk. He looked at him with an expression that screamed scrutiny and judgment. The main guy remained calm and composed. With a patient we can save right in front of us, whose approval are we waiting for at this moment? The only thing a doctor should focus on in front of a patient is chasing after the fragile thread of life. After that, he immersed himself in stitching up the blood vessels in front of him. Next to him, the old man kept mumbling, they're all crazy. What can an intern even do? Then his eyes rolled back, almost popping out. The main guy stood there calmer than ever. The professor looked over proudly and said, with skills at this level, does not he deserve a chance? The old man, still stubborn, said to him, he is good. But Mr. Hong glanced at the doctor next to him. He shouted angrily, what are you doing? Doctor, are not you performing the lobectomy? I will do it right away. Tom seemed to stand still in the emergency room. Mister? Hong called out. Professor Kim. Oh, you are here. Chief, I am here. You did not need to come. I forgot to contact you. The situation was too urgent. Professor Kim finally arrived and asked, has everything been resolved smoothly? Professor Kim looked surprised to the side. Is not that guy intern Dr. Li Minho? Chief Hong feels uneasy and says, yes, it is. Even when he was in the CS department, I thought he was an extraordinary intern doctor, but now Professor Jiang trusts him enough to assign him a vascular connection case. Professor Jiang, are not you favoring Dr. Li a bit too much? He immediately replies, next year we will establish the DTS trauma surgery department. We can't let a talent like this slip away. Behind them, Chief Hong hears this and feels worried. Ahem. He feels a bit anxious and seriously thinks about the main character. Outside the emergency room, a girl is sitting in pain waiting. Her face shows a sad expression. She picked up the phone and said, honey, how's my husband? He is in surgery right now. She could not hide her worry and said, the doctor said there was not even time for a CT scan. They said he went straight into the operating room after just an X-ray. The cardiothoracic surgery and trauma surgery departments are working together on it. They said his ribs punctured his lungs and heart, and the steel rod in his abdomen shattered his internal organs. My husband won't die like this. Will he? The man reassured her. Medical technology is very advanced nowadays. He won't die. Did you request the surgery video? Yes. I listened to you and called back to request it. You are in the countryside gathering news and you will return tomorrow. After the surgery, talk to the hospital's administrative office and ask them to send the surgery video to your email. I used to be a doctor, so I can tell if a specialist performed the surgery properly or if a resident did it clumsily. The woman replied sadly, yes, stay strong. At times like this, you need to be strong. She could not hold back her tears and said, I will try. Sister 0734 call ended. This guy is fuming, thinking which bastard threatened his sister like that. If the rib had pierced the lung and heart, he would have died long before reaching the hospital. If a resident doctor operated on him, I swear I won't let it slide. Then it turned completely dark. Inside the room, he opened his laptop to check. He just started the laptop when his phone began to vibrate violently. He picked it up, his face a bit tense. Data request for Seoul Hospital surgery. Data request for Seoul Hospital. He clicked on it. Watching the tense video clips appear, he was stunned and could only say, well, his condition is quite serious. Let us see the names of the professors are. The list of medical staff involved Zhang Taiju, Huang, and Bo. He looked a bit lost but intrigued. Are these all quite famous professors? The image zooms in on him working diligently. He asked pensively, who is that doctor? The next morning at the department chief's office, no matter how much I think about it, I still can't believe it. Honestly, with just a bit more training, his skills are good enough to surpass Professor Kim Joo-hyuk. Is he really the same person I used to scold? The old man pondered back then, was just someone killing time until his internship ended. The door creaked open. A voice spoke. Professor, I am Lee Min-ho. I heard you were looking for me. He squinted suspiciously, then said, come in. The main guy walked in, towering over. The old man politely offered him a drink. I think I have misunderstood you all this time. Seeing your circuit tracing skills today, I now understand why everyone's opinion of you has improved so much. I heard you were planning to choose our department. Are you serious? The main character responds emotionlessly. That was the initial plan. The initial plan? Yes. Recently, Professor Jang Tae-jo has given me many opportunities, so I've been leaning a bit towards the trauma surgery department. I see. It seems like Professor Zhang is determined to mentor you. He blames himself. If only he had treated you a bit better. Maybe you would not have changed your mind. I am sorry for the way I treated you. This year, I've been sued a lot for medical malpractice, so I've been very stressed. In hindsight, that is not something an intern should be responsible for, but I unfairly blamed you. He sincerely said, once again, I am sorry. Suddenly, the main character's face wrinkled like a monkey's butt, saying, this is really too much. The old man was stunned. He continued, no buts. It is all in the past. Yes, thank you. Then his face turned serious. But there's one thing I want to ask. When I become a resident doctor, please allow me to observe your surgeries on my days off. The old man looked puzzled, like what is wrong with this guy? Can't you just observe from the video room? Watching on a screen and witnessing in person are two completely different worlds. I want to learn by observing right next to you, Chief. Your personality might not be the best, but looking at his skills, I can tell how much effort he has put in to save the patients. It is not just mechanical movements. I can feel his deep desire to save lives. I understand why he was once called the best thoracic surgeon. I also hope to receive your guidance and encouragement in the future. Me too. Unlike in the past, it is better to have more allies than enemies here. Nowadays, having a professional team is wonderful. The department head is cheerful. Thanks for saying that. So instead of just observing, how about assisting in my surgeries with your skills? You could even get dual certification later. Dual certification, obtaining an additional specialty certification through dual training. I am worried I might take away opportunities from other doctors who said you have to do it all the time if you occasionally assist and accumulate experience throughout your 4-year residency. You can definitely get dual certification sooner. The main guy cheerfully replied, if you give me a chance, I will do it. Good. How fascinating can a trauma surgery be? The dean's office was filled with laughter. It feels like no one here ever goes home at Seoul University Hospital. In the room, there was someone sitting there with a rather arrogant demeanor. Looking at that leg, it was clear the department head was shuffling over. He asked, you said you wanted to see me. The man replied, yes. You're Professor Huang and Bong, right? He pulled out his medical journalist ID to intimidate a bit. This is my business card. I was very impressed when I saw you as a panelist on the medical channel in the past. Before I became a medical journalist, I was a doctor, completing my internship at Dongjin University Hospital. Oh, the department head was surprised. Oh, really? He emotionally recounted. Yes. I was deeply moved after watching your video, and the other professor's video performing surgery on my brother-in-law yesterday. That must have been a very difficult surgery. Thank you. I am just grateful that you thought well of it. So I would like to make a suggestion. I am currently trying to inform the public about the hardships of doctors, and I have been covering university hospitals in the region. I was wondering if I could cover the thoracic cardiovascular surgery department of Suk this early for the Chuseok occasion. The director said, it would be fine if the treating professor allows it. The department head sat down with difficulty and said, I appreciate the thought, but if we're gonna do this, would not it be better to cover the emergency room? The busiest place during Chuseok, all the doctors in the emergency room work full shift during those days. Oh, the journalist appreciatively said, I think that would be better. I did not know much, but I looked up the list of doctors from yesterday's surgery. The medical staff involved, Jang Tae, professor of emergency medicine, Huang and Bong, head of thoracic surgery, Ongu Kwan, specialist in thoracic and cardiovascular surgery, Lee Min-ho, no information, Shin Hee-cheol, specialist in emergency medicine. Professor Jang Tae-ju's team also seemed very skilled and had great teamwork, especially the vascular connection. It looked like that person had done it at least a few 100 times. The head of the department mentioned Maine, happily said, that kid is an intern. The journalist looked bewildered like a rhinoceros. Even the head of the department was already amazed enough. He said, I have never seen an intern like that. He said he had a suture kit in high school and practiced, but that is not something you can achieve just by practicing. I thought he was at least an associate professor from another department. Whether he is an intern or an associate professor, all that matters is that he is good at surgery. I heard that besides vascular connections, his diagnoses are also very accurate. He seems to be the type of person called a genius. The journalist laughed unexpectedly and said, if the professor says so, it must be true. The journalist is very interested in that topic, and the public goes crazy for such special stories. This could be huge. Then the scene shifts to Professor Jiang making an announcement to everyone. During the holidays, a reporter from a medical magazine will come here to film our emergency room. Do not feel pressure by the camera. Just do what you always do. We have already been busy with the influx of patients during Chuziak, and not just us, but the patients won't like it either. He reassures it is not a TV show. What is the big deal? And during the holidays, many drunk patients will come to the hospital. With a camera around, maybe they won't cause much trouble. Do not just think about the negatives. Think about the positives, and accept it. The director has approved it, so nothing will change. A few disagree and murmur below. He added, from now on, Dr. Lee Min-ho will assist in all my surgeries to handle all emergency surgeries during Chidziak. You will need to gain as much surgical experience as possible. For someone obsessed with saving patients like you, Maine, that is wonderful. Got it. Then an irritable old man spoke up who gave you the right to bring Dr. Lee Min-ho in all your surgeries. Professor Jiang turned to look at this person with some caution. The person who appeared was head of Department Bong, a notorious troublemaker. Anyone would think Professor Jiang is the head of the emergency department. Oh, that is not what I meant. I thought it'll be better if Dr. Lee Ho gained a bit more experience before Chuziak. Professor Jiang, I understand that Professor Jiang is eager because Dr. Lee Min-ho's skills are excellent. But even so, Dr. Lee Min-ho is still an intern at the moment. I have not said much about Professor Jiang using resident doctors as assistants during emergency surgeries, but I cannot excuse you for arbitrarily changing the training content for interns. Even Professor Jiang has to admit defeat when it comes to this guy. I understand. Maine feels heartbroken. My goodness, that was such a great opportunity. What a pity. Just looking at this scene, it is clear he must be trying to hold Professor Jang Taeju back because he feels his position is being threatened. Truly, who would have thought that a discussion about a patient's surgery could turn into a childish power struggle? Maine is angry, but does not dare do anything. I heard from the director. I heard Professor Jiang aloud filming in the emergency room during Chuziak. I understand Professor Jiang's intentions in permitting this, but you should have consulted the other doctors first. I apologize. From now on, I will be more careful. Since the director has approved it, I won't argue further, but please follow basic procedures. And Dr. Lee Ho, come see me for a moment. You keep meeting the bosses. Finally, it is the afternoon at Seoul University Hospital in a private room. He spoke up. I think I've been paying quite a lot of attention to Dr. Lee Min-ho all this time. Is your heart still set on trauma surgery TS? Yes. Treating patients is good, but I prefer holding the scalpel in the operating room. You should know that the emergency department M is much better if you consider your future prospects. Having lived a long time in this world, no. I have not lived long, but even though it is difficult, doing what I want makes me happy. He seriously slammed the cup down. With a sad face, he said, there was a friend among my former colleagues just like you. He also liked to hold 2 scalpels and chose neurosurgery. I tried to dissuade him, but to no avail. Please reconsider. Heiser Scherbier, so do you know how he is now? He asked bewilderedly. If he was your friend, would not he have become a head of neurosurgery? He said that friend is now running a fried chicken business in the next neighborhood. Faster, tastier. Then the uncle pretended to be sad and said, what a pity. Evening comes, you guys should go eat. The scene transitions to a mouth-watering fried chicken restaurant. Professor Jang asked in surprise, really? The head said we could enter the operating room. Yes. He gave me permission before I left the office. He said it in front of others. But he said it is okay if Professor Zhang calls me to assist in surgery during an emergency. What a relief. I was wondering how to clear up the misunderstanding. Then Maine hesitated as he looked at Mr. Zhang, feeling a heavy burden inside. While talking to the department head, what a former doctor running a fried chicken business. Unbelievable, right? But it is true. He performed brain tumor surgery on a famous second-generation chaebol heir in the country, but the outcome was not good, and he was sued. Fear and respect. Prosecution, a doctor's mistake, the defendant's seat. The unconscious second-generation chaebol heir. That doctor was trembling uncontrollably. After years of legal battles, he finally gave up the scalpel. Did he lose the case, mister? Vong said, no, my friend won. But imagine how much stress he endured over those years. Just the hospital work alone is enough to wear someone out. Now you understand why I said, choosing our department was a good decision, right? If that friend had listened to me back then, he would probably be working with me now. Main character sadly said, such a shame. Even Chief Huang and Bond. Lawsuits really are a big issue. Still, I want to hold the scalpel. The old man said painfully. Really, I say this and you still do not understand. I completely understand what you are saying. Even so, I still prefer saving patients through surgery. The man, disappointed that his words did not get through, said, you are quite stubborn, are not you? Alright, set all these emotions aside. As your senior doctor, I hope your decision will lead to good results. You may leave now. The main character respectfully says, "Thank you for your words. I will take my leave." The old man thinks to himself, why are they all so stubborn in such a foolish way? I used to think being a doctor was just about saving patients on the brink of death. Finally, the weight of pain compels him to speak, and then the main character says, "Professor, living as a doctor in this era, it does not seem easy at all." "Why do you say that? Did you hear something unpleasant from Chief Wong?" "No, that is not it. He told me about his friend, a former neurosurgeon who now runs a fried chicken restaurant." Professor Zhang laughs and says, "A fried chicken restaurant? Ah, you mean Chairman Honda, right?" The main guy laughed at the professor, saying he is not a chairman, but a CEO. Mr. Zhang was stunned. This young man even used an older term, and he did. Then he explained that because he has chains of stores nationwide, he is the chairman. A chain of stores is a system where many branches are managed from a central location, but with just a few stores. This brand was started by Chairman Hondo. I also heard this from the director, but he did so well that he made a fortune. That is what they say. That person is really amazing. They say there are dozens of stores just in Seoul, including provincial areas. There could be 100 stores. The main guy then realized he had been played. The old department head pretended to sympathize, saying that friend is now running a fried chicken business in the next neighborhood. The main guy was furious, grabbing the piece of chicken in his hand. He could only vent his anger on the fried chicken. "Dean Huang, you deceive me with that sad face. If I trust that man again," Professor Zhang worriedly said to him, "do not chew on the bones. I am not Hua Tao. I am the son of Chow Chow. Goodbye, my son." Damn it. For him, the long-awaited vacation had arrived, just as expected, but a child cried loudly. "Mommy." The mother, unable to stay calm, said, "Doctor, please look at my child. Hurry up. Please wait a moment. Patient. Prepare for intubation." "Yes, Dr. Wu in high." After checking T for patient number 8, immediately assess the condition of aortic dissection using a chest CT scan. "All right. Contact the radiology department immediately." T. Transesophageal echocardiography. Chest CT, a diagnostic method using X-rays to obtain cross-sectional images of the chest. Aortic dissection, a tear in the aorta. Dr. Lee Min-ho, contact the anesthesiology department, book 2 operating rooms, and assist in surgery for case number 2. Dr. Main anxiously responds, "Yes, the emergency room on a holiday is crazily busy. How many cases have we handled today?" "A total of 62 cases. It is like a battlefield. At this rate, I will die before I can save any patients. It has been quiet for a moment. Maybe we can rest a bit." Suddenly, a nurse rushes over in panic. "Professor." The medical staff called asking if we could take in another traffic accident patient. "What's the patient's condition?" "He is in a coma. His chest is crushed, and his abdomen is full of blood." Crushed chest. This case needs collaboration with the thoracic surgery department. Tell them I will contact the thoracic surgery department first, and then get back to them. You two, get into the emergency operating room for the patient. Doctor. "Oh Gook, it is a call from Professor Zhang Taeju." "Yes, Professor Zhang. This is Ogu Kwan. ODR. Oh, Zhang Taeju here on duty. A traffic accident patient is on the way. They said his chest is crushed. I am calling because I think we need collaboration with the thoracic surgery department." "I am sorry, Professor. I do not think I can handle any more surgeries today. This patient has been rejected by every other hospital. If we do not take him in, he will die." Dr. "Oh, I really sympathize with him, but there have already been too many surgeries today. Above all, 2 patients have died during surgery. I am currently operating on a patient whose life is in danger. I am truly sorry, Professor. I do not think I can do it. If that is the case, I understand. Keep up the good work. Ogukwan 0636 is on duty." "You too," he said sadly. "Sigh, there is nothing we can do. Sorry, but please call the medical staff and tell them we can't take the traffic accident patient." He instructed the nurse next to him. She replied, "I understand." The main character could not believe it, thinking, what, is he going to give up that easily? At this moment, he spoke up. "Wait a minute, Professor. That patient's chest, can I be the one to examine it?" The professor looked at him, in astonishment. "That is absurd. No matter how many surgeries you have assisted in recently, how can you handle the chest alone?" Dr. Lee, "If something happens to the abdomen," he said, "I can take responsibility, but not the chest." The main character, looking dejected, said, I know I am still inexperienced, but if we also give up on him, the patient could die without anyone trying to operate. Even so, this is not something you can take responsibility for." Dr. Lee, "If there is a problem with the patient, the family might sue." The main character stubbornly said, "I know." The main character confidently stepped forward and said, "When I get the surgery consent form from the patient's family, I will clearly state that there are no specialized chest surgeons in the operation. If they decide to give up, after hearing that, then I will also give up." He frowned. "No matter how much we fear a lawsuit, we can't just stand by and let a potentially savable patient die." He thought that by assisting in the surgeries of the chest surgery professors so far, if we make good use of what we have learned, the patient could be saved. The patient's heart had stopped beating, but thanks to the dedication of the doctor, it came back from the dead. This made him more determined than ever. He finally relented and said, "All right, I understand. If you get the consent form under these conditions, let us proceed with the surgery for the patient." He excitedly said, "Thank you, doctor." Then the ambulance delivered the patient right to the door. The patient lying on the stretcher was handed over to the emergency team. Everyone proceeded with the usual first aid and cleaning. What is the patient's systolic blood pressure? 70. Damn it. Hang 1 liter of normal saline in /S and set the drip rate to 300 drops. Looking at this patient, you say, "We might need another 4-line depending on the situation." A nurse runs in and says, "Professor, the patient's family has agreed to the surgery." Good. Use the portable X-ray machine to scan his chest and abdomen and contact anesthesia to book in, or then everyone heads to the emergency operating room. Inside, everyone is racing against death to save the patient. A stranger doctor walks in. The main guy was surprised. "Is not that guy an intern in the CS department, Lee Sang-jik? You're not here to assist in surgery in place of Dr. Oh, Gu Kwan, are you? Hey, be grateful that at least I can't help. Dr. Gu Kwan is still in surgery." The main guy gave an understanding look. The guy's going through a lot too. I used to think he was heartless for rejecting so coldly, but now I feel sorry for him. After that, everyone returned to their tasks. All right, we're out of time. Dr. Lee Sang-jik, you will stand next to me. Dr. Lee Min-ho, you will assist Dr. Shin Hee-cheol. Everyone simultaneously followed orders and got to work. I was very surprised to hear Min-ho would handle the chest, but it seems Professor Jang Tae-ju will take over as expected. Of course. Then he continued to carry out the assigned task. No matter how good he is, there's no way they would assign the chest area to an assistant surgeon. Mr. Shin said, "Dr. Bae, the preparation for the surgery are complete. Anesthesia has been administered. Then I will begin the surgery. First, make a light incision on the skin, then blood splattered like a waterfall. Wherever the incision went, blood sprayed out. Everyone was tense. The main guy was worried, losing too much blood. After opening up the abdomen and looking around, he wondered where's the blood coming from with this much blood loss inside the pleural membrane. It is running along the bone to the internal thoracic artery. This is a major blood vessel that supplies blood to the anterior intercostal arteries, the superior epigastric artery, and the musculophrenic artery. Since it supplies blood to so many arteries, the blood pressure is very high, so continuous bleeding like this is bound to be severe. The lead surgeon ordered, "Clamp it. Use clamps on the blood vessels or human tissue." "Yes, sir." The 2 lead surgeons were a bit anxious. "Damn it, where's the blood coming from?" Then while operating, he was startled. He brazenly inserted the clamp into the patient's abdomen. He did not understand why he was pulling back the flesh. He ignored the doctor spraying adhesive, just kept going, and the doctor spoke up, "Hey, what are you doing? Stay still." He did not care. Finally, his eyes lit up. He pulled back the muscle and said, "It is here." Then he brazenly clamped the 2 arteries to stop the bleeding. The doctor looked at the patient's abdomen in bewilderment and said, "The bleeding has stopped." "How did you do that?" "I predicted it based on the location of the bleeding, the color, and the amount of blood." "What? Does that make sense?" Then Professor Jiang put on his glasses and said, "Dr. Lee Min-ho, switch places with Dr. Lee Sang-jik." He responded, "Yes," and then just did it. "All the patient's indicators are fluctuating. As long as they have not crashed, it is fine. While I separate the tissue, you perform the internal mammary artery anastomosis." "Yes, doing big work. You can even order your boss around. Hand me the clamps and needle holder. Here you go." Then he skillfully sutured it back. For the internal mammary artery, it is best to restore blood flow as quickly as possible. He is really fast, just as expected. This is why I can't say anything even when he oversteps his authority. The anterior intercostal arteries were severed when a rib broke. We will reconnect them after dealing with a lung tear. So for now, just find and tie them off. Yes. Then he advanced the clamp deeper, vaguely seeing the rib cage and lungs. His eyebrows furrowed together. The pleural cavity filled with air and blood. I have performed countless of emergency surgeries, but with a tear like this, I have never directly handled a ruptured lung. This is a field where thoracic cardiovascular surgery specialists should operate. He worriedly thought, "Can I do it?" The main assistant beside him noticed his hesitation. "Professor, this may be a bit sudden, but when I observe surgeries in the thoracic cardiovascular department, I have handled patients with lung tears or ruptures a few times before." "What?" Fortunately, the post-operative progress was very good, and the professors in the thoracic cardiovascular department recognized my skills. "Can you trust me to handle it this time, Professor?" "All right." From the very beginning, I proceeded with this surgery because I trusted Dr. Lee. If we delay any further, the patient's life will only be in greater danger. Then the professor said, "All right, let Dr. Lee Min-ho continue. I will cut the torn edge of the pleural membrane, so please prepare the suction device." Standing next to his favorite student, he obediently said, "All right." The main guy continued deeper into the organs. The blood appeared, and the older man suctioned it away. Finally, they delved deeper into the fractured area. "We need to suture the damaged area. Expanding the pleural membrane too much will burden the patient, so it must be kept to a minimum. You pick it up and skillfully suture it." The blood was gushing out like a storm, suctioning so much that it nearly filled a whole container. He had a race against time, being precise with every stitch. The two coordinated smoothly in and out. Then the suture looked clean and neat. Finally, the step of cutting the thread. "I think we can remove the suction now." "Okay." He stitched it meticulously, just as expected. Then there was a noise outside the emergency surgery door. A person in disinfected slippers came in and said, "Professor Jung Taiju, I have completed my surgery." "Dr. Ogukwan, so you finally arrived. Dr. Lee Min-ho, you can switch out now." The main replied, "Ah, yes." Everyone continued with this lengthy surgery. Dr. CS was surprised. The lung has been stitched already. Luckily, the heart and bronchus are fine too. At this point, there is nothing more for me to do. Of course, the ribs will need to be fixed. Just a minor rib fracture. Everyone quickly continue with your tasks. Such a relief. Dr. Lee Min-ho has done everything. The main character calmly replied, "Observing surgeries has been very helpful. It is truly amazing." Dr. Wan looked at him with interest and said, "How about you finish it, Dr. Lee? I will observe from the side." In general, our main character never minds getting hands-on with patients like this. You could see his excitement even through the mask. Yes. Inside the brightly lit emergency room, the emergency room registration, 15 people. The scene outside bustling like a festival. The reporter excitedly said, "Today is finally the day we get to do a feature on Dr. Lin Min-ho." He looked at the main character like a juicy prey, making him get goosebumps. "Is there anything newsworthy about me? This is a bit distracting. Of course, just examine the patient as you usually do, but occasionally make it look a bit more strenuous. You know what I mean, right?" The main character frowned at him. "Make it look strenuous." "Yes, you went through a lot yesterday. It is just that when taking photos, that feeling did not really come across. A young doctor, a genius loved by the public, a doctor like that with the sole mission of saving patients. No one would dislike seeing someone dedicating their youth to their work, but I can't let others see me struggling in front of a worried patient. And the feeling of being rewarded is greater than the struggle," he emphasized. "I do not want to force myself to act in a certain way." The journalist was surprised. "Oh, really?" The nurse rushed over. "Dr. Lee Min-ho, please take a look at the patient with the wound here, specifically a laceration, a cut from glass and knife." He immediately turned around and responded, "Yes." His face looked so cool whenever he heard about an injured patient. Lying in front of the emergency bed was a baby holding her face and crying. The wound on her leg, although bandaged, was still bleeding, staining a large area of the bed red. However, the mother frowned at him and said, "Sorry, I think my daughter needs a plastic surgeon." He was bewildered by this attitude. What it is the Mid-Autumn Festival Chuseok and it is already evening, so all the plastic surgeons have gone home. At night, she made a fuss and arrogantly said, "Is not there anyone on duty? In the evenings on holidays, we mainly treat emergency patients. The dermatology and cosmetic surgery departments do not have staff on duty." She rudely pointed at the main guy. "So can you contact the cosmetic surgeons? Beautiful legs are very important for a woman." The nurses and doctors around were helpless with this ignorant mother. "You just look down sadly. Your daughter is crying over there. If you're a parent, should not pain relief be the top priority, parents these days?" The little girl was in so much pain that she could not stop sobbing. "And look at that swollen bloody leg. Judging by the color of the blood and the location of the wound, it looks like the small saphenous vein has been damaged. It is a vein in the foot running behind the outer ankle and the back of the calf. At least disinfect it first." She interrupted, saying, "That is not important, but the stitching must be done by a cosmetic surgeon." He said painfully, "I can try to contact them, but I do not. I know if they will come see her. Please disinfect it first. If not, I will find another hospital." When he just opened the bandage, seeing the girl's wound was both deep and long, the saphenous vein might be around here. He ordered the nurse beside him to irrigate, which is a method to bind blood vessels or ducts to stop bleeding or prevent bleeding during surgery. She responded yes. The wound gradually became clearly visible, extremely deep. The girl tried hard to bite her teeth to prevent a scream from escaping. Please lift the girl's leg gently. Okay. Beside them, the journalist also winced at the sight of the wound. The main guy observed, "This looks exactly like a wound that has cut through the dermis and reached the muscle." Then he carefully cleaned the wound bit by bit. "This wound is quite deep. The muscle is also damaged, and it seems that an important vein carrying blood from the calf to the heart has been severed," he said. "We need to perform vascular repair immediately. We also need to suture the muscle." so I will consult with the surgery department first. Then the mother said, wait, in that case, please go ahead with the vascular repair or whatever, and I will contact the cosmetic surgeon I know to handle the skin. She left without caring about the critical issue concerning her child. She immediately contacted the cosmetic side saying, yes, hello. The journalist watched her leave and sarcastically remarked, she is really working hard. The main guy's eyes showed a hint of sadness. Should we see this as love for a child? Or you should see how they treat their child like a possession. Then he want to check on another patient. What brings you here, sir? I was helping my wife cook when, next to me, a patient suddenly screamed. Sorry, I've been here long before him. When are you going to examine me? We do not operate on a first come, first served basis. We prioritize patients based on emergency levels, so we ask for your understanding. Then he angrily started dialing on his phone. Yes, we encounter patients like this at least once a day. A dark cloud hovered over his head, and he sighed in frustration. I wondered when this would happen today. The main character avoided calling out, Dr. Woo, and hi. Can you take a look at that patient for a moment? She casually replied, all right. Sir, were you feeling unwell? Then the main character turned back to check on the patient. Please continue with what you were saying. He continued, I was helping my wife eat when I suddenly felt chest pain, so I came here. Are you taking any medications? I am taking medication for blood pressure and diabetes. An elderly patient taking blood pressure and diabetes medication experiencing chest pain. Is it a heart or aortic issue? How long has your chest been hurting? About an hour. Previously, I only occasionally felt a lot of headache, chest tightness, but today it suddenly started to hurt a lot. He orders the nurse next to him. Start with a blood test first. Please escort this patient to the blood test room. Yes. The stretcher was pushed away plus one patient handled. His phone suddenly rang during the shift. Plastic surgeon. Lemmy Rand called. He did not understand and picked up the phone. All the plastic surgeons. Should not they have gone home by now? Yes, Dr. Lemmy Rand, Dr. Limonho, did you just examine on Ji-hyun's daughter? On Ji-hyun. Patient's medical record. Choi guardian. Mother on Ji-hyun. He replied. That is right. Did you call the plastic surgeons and tell her they could not come to the hospital? She frowned deeply and said, why? Why did you lie? Even he was surprised and asked back what? I did not receive any calls and the other professor said they did not either. He hesitated and replied, well, because it is a holiday, I thought calling the doctors would be very troublesome, so I just made it up. Do you know her? She laughed out loud. Look here, we are the ones who decide whether it is troublesome or not. How dare an intern like you say that? Even the main character did not understand why she suddenly got angry. What is wrong with this woman? Then he replied, so what should I do? She yelled into the phone, what did you say? What are you afraid of? Just say it. From now on, whether it is day or night, if a patient comes, even if it is not a big deal, I will call each and every one of the plastic surgeons. This doctor woman went crazy and said, how dare you speak so arrogantly? He did not understand, so he replied, I am busy now, so I am hanging up. You hung up on me crazy. He hung up with a snap. Being called and scolded for no reason, he sighed. I feel like I am about to get dragged into some trouble. Then the scene shifts to the emergency room. A person is being checked for cardiovascular issues. The main character looks at the monitor, then the test results are printed out for him to read. There is definitely something wrong with his heart or coronary arteries. Why is the Saint segment elevated and the biomarkers only slightly increased in such cases? We should wait a bit and repeat the tests. But I feel the patient's condition is deteriorating rapidly. Please prepare for a transesophageal echocardiogram. Yes, the ultrasound probe is inserted into the esophagus to obtain images of the heart, lungs, and surrounding structures. Another doctor opens the examination room door and enters. He called Dr. Limonho, did you just hang up on Dr. Lyman ran from the Department of Plastic Surgery. She called me and was extremely upset. You were annoyed and troubled, thinking that eventually she would use her superior to reprimand you. The department head suggested, why don't we step outside and talk for a bit? You interrupted. I have an emergency patient right now. Can we discuss this later? He glanced over. An emergency patient. You replied, yes. I suspect it might be acute coronary syndrome ACS, a condition where the blood supply to the heart is suddenly blocked by blood clots of varying sizes, causing severe obstruction in the coronary arteries. Have you checked the electrocardiogram ECG? You answered, yes, I have. There is no significant elevation in the ECG or the biomarkers. However, considering the patient's age, medications and symptoms, I still suspect acute coronary syndrome. The doctor did not make things difficult for you anymore, and said, all right, begin the examination immediately. After that, the two of them conducted a more thorough examination for the patient. They watched the screen together worried. The main character furrowed his brows. Just as I thought, one of the coronary arteries was severely inflamed. Dr. Moon Seom Ryong, it seems the acute coronary syndrome has progressed to a myocardial infarction. The The main character worked with utmost seriousness and responsibility. The department head stared at the test results in front of him, frozen for a moment. I almost caused a major issue by pulling a diligent doctor away from treating a patient. At that time, she scolded him harshly. Dr. Moon, I think you need to re-educate your intern, Lee Min-ho, on phone etiquette. In all my years, I have never seen an intern hang up on me before I finished, speaking just because he was busy. At that time, he was being yelled at so much, it hurt his eardrums. Did Dr. Lee Min-ho really do that? He is not the type to be rude. But yes, that is what I am telling you. Do something about him. At first glance, this guy looked really shady. The more I thought about it, the angrier I got. Turns out he'd been working hard. Some of us had to work shifts throughout the holidays without proper sleep, and yet she called me just because we did not serve a cosmetic surgery patient. I need to stay calm. I should not jump to conclusions and blame an innocent person after hearing only one side of the story. After that, many patients came and went. The holiday season finally ended. Sunset at the hospital. The main character felt like a zombie, thinking it was as if a storm had just passed. It was more bearable than expected, but he was still exhausted. Dr. Lee Min-ho. It is Professor Kim Joo Hyok from the CS department calling. Ah, yes. This is Lee Min-ho speaking, Professor. He sounded displeased. Hey, why don't you pick up? I'm sorry. I had my phone on silent and forgot about it. The reason he put on silent was because the ringtone kept interrupting him while working. Jack sparkled in the vast sky. Plastic surgeon Dr. Lamy ran 32 missed calls. He was startled, thinking, has it gotten this bad? Then he admitted the phone was interfering with patient care, so I put on silent. I am sorry. I see. Well then, last time you mentioned wanting to observe a VAT surgery, did not you? He smiled brightly and said, yes. Has any surgery been scheduled yet? For operating room 1 inch 20 minutes. We were performing a lobectomy for a lung cancer patient, so come if you can. Watching a surgery up close is like playing with toys. He said enthusiastically, got it. Thank you, doctor. After he hung up the phone, he excitedly ran through the hospital. Next to him, the journalist who was still there said, I overheard that you're going to observe a surgery. Can I observe it with you? He picked up his equipment ready to record, then looked at him in amazement. Even after working so much, he still loves to observe new surgeries and learn from them. Seeing the eager eyes of the main character, the journalist thought, I probably can't keep up. If it is Dr. Lee, that is.